she's one of our main partner. Fountain House is one of our main partners for,
Right.
Yeah. So should I just let her to?
She can just do the process. She can put in her name and that's fine.
And then Nellie can bring her over when we need to.
Okay.
Right.
Thank you.
Right. So let's get started since we have a quorum. And everyone is. Let's see. I'm shrinking my screen, so you can just let me know what's happening if I need to stop or anything. So good evening, everybody. Maria Ortiz, co-chair of Housing, Health, and Human Services. This is the January 2021 meeting. The agenda and the materials for tonight's meeting are public and can be viewed on the website. If you're on our listserv, you also get email blasts of the agenda and all committee updates and meetings. The meeting is being recorded, and I'm giving this little spiel for those of you who may not have been on one of these meetings before. The meeting is being recorded and will be accessible on our YouTube page. It's also live streaming right now. If you've never done one of the meetings before, everyone should be staying muted throughout the meeting except for whomever is speaking. After the presenter speaks, the committee is going to ask questions or make comments. Then members of the public or the attendees have the opportunity to do the same. Then the discussion goes back to committee. On some items, the committee members will then vote to write a letter of support or to make recommendations. If you want to comment, and this is especially for the public, the attendees, to comment or ask questions, press the raised hand button on your screen. You should see it on the bottom somewhere. If you're calling in, you should be pressing 9 to raise your hand and pressing 6 to unmute. Again, that's 9 to raise your hand, *9 to raise your hand, and *6 to unmute. Does anyone have any questions about what I just mentioned?
Nellie, Michael Noble has a hand raised, board member. Is he in the wrong spot?
No. Hold on one second. Mike?
Mike, did you have a question?
Yeah, I just wanted to, see if you saw me, and I will be asking a question, and I can't see who's there. I can't see the participants. You guys do it different. Anyway, I'm here.
Oh, okay.
Thank you.
Not a problem. Got it.
All right. Good to have you, Mike.
Okay.
So our first presentation is going to be by Dr. Siddiqui, Ryan Chelsea Clinton Health Center. If you don't know, it's our neighborhood health center. They provide healthcare for children, adults, seniors, primary care, dental care, eye care, opioid addiction treatment, sexual reproductive health, and more. Dr. Siddiqui is here to discuss the COVID vaccination distribution there at the center and how that's going. Dr. Siddiqui, and also Charlene is here as well for that.
Hi,
Thanks.
good evening, everybody. Thank you, Maria, for the wonderful introduction. We are your community health center, and we do all the things Maria mentioned. Charlene helped me put this presentation together, so thank you for that. And with that, I'm going to go over the COVID vaccine. There's a lot of questions about it. I gave this presentation not too long ago, and this one's going to have a little bit more detail. Let's go to the next slide. Okay, so just a quick agenda. I'm going to go over what mRNA vaccines are, and then I'm going to spend more time on the Moderna vaccine. That's the vaccine that we have at our community health center and what most community health centers will have. Pfizer is going to be mostly at the hospitals. So I'll go into a little more detail, mostly on Moderna, but a lot of the same things apply to Pfizer. Go over ingredients and allergic reactions. That's a big part of a lot of people's questions. Talk about some of how community vaccination is going, and then cover some commonly asked questions that I've been getting over the last few weeks. Okay. So this is a little bit of a busy slide, but it talks about comparing traditional vaccines and mRNA vaccines. This slide, the purpose of it is to highlight the difference, because there's a lot of questions about how did this vaccine come out so quickly, and other vaccines have taken a longer time. One of the important things to know is that mRNA is faster to produce, and the process was fast-tracked because of the pandemic and the urgency of this. So in the past, there would be a lot of more roadblocks along the way and things that slowed down production, which has been different for mRNA vaccines, which is not a new type of vaccine. mRNA vaccines have been studied and possibly under trials in the past for other viruses and diseases such as Ebola and SARS. So this is not a brand new concept of a vaccine like this. Next slide. Okay, so this goes a little bit more into detail about how it was developed so quickly. So as they started doing the studies, manufacturing had started, was underway in preparation for a pending FDA approval. Like I said, they're faster to produce, and the FDA and CDC accelerated the process by prioritizing the review and authorizations for the vaccines. But that's not to say that none of the usual extensive clinical trials did not go underway. The usual trials did, and I'll go into a little bit more detail about that. So we could go to the next slide. Okay, so we have the Moderna vaccine, and the reason why we have in most community health centers, your local community health center will have it, is really about the storage and packaging of the vaccine. The Pfizer vaccine has to be kept at a sub-zero frozen level that most community health centers are not going to be able to purchase, and we don't have immediate access to. So the Moderna vaccine is a lot easier for us to keep. Most hospitals do have those type of freezers, so they have the Pfizer vaccine. It's 2 shots, so and they're 28 days apart. So usually you get part 1, and then when you get part 1, you are scheduled for your second day. And there's a little wiggle room about a few days. It could get a little bit earlier if you have to get a little bit later, but in general, we want to keep it that 28 days apart. And it's usually given in the arm and does not contain any of the preservatives like eggs or latex. Next slide. So this, I'm going to go into a little bit of the detail about the study of specifically Moderna. It was studied in over 30,000 patients. And on the right side here, what you see is the race and ethnicity demographics of the vaccine. And it was predominantly white population, about 20% Hispanic, 10% African American, 4% Asian, and 3% other. As the vaccine trials went on over time, I don't have this graph here, but they did start to include more people in minority groups to increase those numbers into study. On the left-hand side, what you're seeing is the US racial demographics of our current makeup in the United States, which is predominantly white. And then the next larger groups is Black and Hispanic, Asian, Native peoples, and multi-race. So if you look at the purpose of putting these both together is to show that, yes, that there is differences in the races that were studied, but also it is a reflection of the makeup of the United States as well. So if we go on to next slide. So there's a lot of questions about the ingredients, and that's because I'm going to talk a little bit about later is one of the reasons is not to take the COVID vaccine, and actually pretty much one of the only ones, is if you're allergic to one of the components of the vaccine. So that begs the next question, well, what are the components of the vaccine? And those are listed here. And these are not typical words we're going to know. It's like reading the back of a shampoo bottle. You know, what is this stuff? Messenger RNA is RNA. We have DNA and RNA in our body. So messenger RNA is the sequence. It's sort of like the code for the spike protein of the COVID virus. So it's not the virus. It's sort of like its blueprint. And then that is read by cells. So that's kind of, it's a natural product. Then the next part, and this is the one that most people, if they do have an allergic reaction to, this is a component, is lipids, which is another word for fats. SM102, polyethylene glycol, cholesterol, and these are common components in actually quite a few things that we commonly use. They are used as various lipids in things like petroleum jelly or other vaccines, commonly used. And there was another one that I'm just forgetting off the top. Laxative, polyethylene glycol is a very common laxative. So if you've had an allergic reaction to a medication in the past, or if you've had a reaction to a vaccine in the past, then it's worth having a conversation with your medical provider is, could I be allergic to one of the components of the vaccine? But if you've never had a reaction to medications in the past and to a vaccine in the past, then you're likely not allergic to these components. Tromethamine, hydrochlorothiazide is are some salts that are in the that are commonly also used in medications and salts. It's to stabilize. It's to work with the acidic levels in the vaccine. Acetic acid is another word for vinegar. This is a common table of vinegar. Sodium acetate, again, is another salt that is in, it's like in a lot of food products. And sucrose is also another word for sugar, which is in a lot of food products. So if you're not sure, if you've had a reactions to foods or medications or vaccines, then have a conversation with your medical provider if you might be allergic. But if you haven't, you're likely not, if you have not had an allergic reaction to any of those things, you're likely not allergic to the vaccine. Okay, so moving on. So it begs the next question is, well, I don't know if I'm allergic because maybe I've never interacted with that substance, which is understandable. That is possible. So we have protocols in place, these are set by the CDC on after the vaccination, everybody waits about 15 minutes. Because if you're going to have an allergic reaction, a serious allergic reaction, the body's going to react to it right away. And we're going to know within the first 15 minutes if you have an allergic reaction, and the medical facility that you have the vaccine at will be prepared with medications to treat the allergic reaction. For people who have a history of anaphylaxis, meaning allergies so bad that they can't breathe or they're wheezing or their lips swell, they wait for 30 minutes after the vaccine, a little bit longer. Once you've waited that period of time, as long as you're fine, you're free to go. So then moving on. So is the COVID vaccine effective right away after the both doses? It takes a little time for vaccines to work. So after the first dose, there's about estimated 40 to 50% protection. And then it's after the second dose that you reach that 95% protection from the vaccine. And the way vaccines work is that your body is building antibodies to fight a future infection. So it takes your body some time to build those antibodies. And that could take 1 to 2 weeks. So I would say it would probably be from the first day you took the vaccine, be about 6 weeks after that you would have more immunity. And during that 6 weeks time, it's really important to keep doing all the precautions. Not everyone's vaccinated, so it's important to do the mask wearing, eye protection, and the physical distancing. Washing your hands. Can the COVID vaccine give you COVID-19? No, it cannot give you COVID-19. It does not have components of the virus, or is not like some vaccines are a little bit of a weakened virus. This is not virus components in any way. Okay. Okay, can pregnant and breastfeeding women get vaccines? This is a really common question for women of reproductive age. So part of the way we study medications and vaccines is women breastfeeding or pregnant are not included in preliminary trials. Same thing with pediatric. As we go forward, we are starting to include the Pfizer and Moderna are starting to include children and pregnant persons. They are following a few of the pregnant people that, not pregnant people, but people that took, so of the 33,000 people that were studied, some did go on to become pregnant. And the CDC and research, they are following these persons to report what the findings are. However, theoretically, it is not expected that this would cause any harm to fertility, pregnancy, or to lactating mothers. But this is the recommendation from ACOG and a lot of the organizations is to make the patient and the medical provider should make a decision, a shared decision. Consider your risks, consider if you want to have the vaccine or not, and then make the most informed decision for yourself. Should you get the vaccine if you already had COVID-19? And the answer is yes, you should get the vaccine. Just don't go in to get the vaccine while you're currently sick. We don't want to expose other people to COVID-19. So if you are sick, wait until after the period. And there are a few people that are treated with some medications for COVID-19 that if you were treated with one of those medications, then, sorry about that. So treated with COVID food delivery. If you are treated with COVID-19 medication, then you do need to wait 90 days. Okay, next. Okay, so community and patient vaccinations. We are vaccinating our patients and persons in the community that are in the priority groups. There is self-scheduling online. So if you go to ryanhealth.org, you can request a vaccine. For the most part, we're doing vaccinations in the evenings and the weekends. And the reason for that is because we have a very busy center during the day and we want to keep track of the flow. And so we want to make sure it's during a time where we can observe social distancing. We're partnering with our community. So we realize that there are persons in our community because of either their resources or the way, just based on social construct, they may have lower access. Either they don't have they don't have availability to use the internet to get online, or may not have the literacy level to advocate for themselves for the vaccine. So we're making sure that we're making community partners and then helping those communities get vaccines. So some of those are Ivan Shapiro House, CHDC, Fountain House, and many more. Especially those communities that have elderly who are really uncomfortable leaving their homes to come in to get a vaccine. So I'm going to go over a little bit of the priority list. So right now we're only vaccinating 1A and 1B. So that is New Yorkers over the age of 75, frontline health workers, dentals and dental staff, home care workers, hospice workers, long-term care residents, teachers in New York City, DOE nurses, officers, firefighters, and the MTA frontline staff, so basically anyone front-facing. And then 1B, which is the phase we're in now, which is the next slide. Actually, the next one here is now open to teachers, first responders, public safety workers, public transit workers. Oh, I mentioned those. Also people 65 and above, we are vaccinating as well. And as time goes on, we're working into areas such as looking into people with underlying health conditions. So we are beholden to New York State and their guidelines. So we follow those guidelines strictly. And as the phases roll out, that is who we will be vaccinating. And I think that's the end of our presentation.
Thank you, Dr. Siddiqui. I wanted to ask you one question before the rest of the committee asks you questions. And I'm just wondering, what happens if, there's a bit of an echo, I'm sorry. What happens if someone gets one dose, the first dose, but there's not enough for them, there's not enough around to get the second dose 28 days later? I'm just curious, like, has there been a discussion about that, and what does that look like? What does it mean if it's, I don't know, 8 weeks later or 12 weeks later?
Yeah, so I know there's a lot of concern about that, and if you're on message boards, or I know I've seen across the country, some of my colleagues have been saying their second visit has been canceled, which is really distressing. That hasn't happened at our center, and we have gotten time and time after again reassurance from the District of Health that everyone that gets their first vaccine, there is a second vaccine coming from them, and so far that's held true. We've gone through our first real set of doses, and we got a package that said this is dose 2. So, and I'm going to remain optimist, and that shall continue. But if that does change, for example, a lot of you probably heard there are other countries who are planning to only do the first dose. Then what that means is, for, like I was mentioning, for the first dose, 40 to 50%, that would give about 40 to 50% immunity. And I'm not exactly sure how long, if there is a window period that after a certain period of time and you get that second booster, that you lose some efficacy. I haven't seen any data on that, but that may come out soon.
Okay.
Thank
you. And I know JD has his hand up, then I saw Josephine, then Leslie.
Thank you, Maria. Can I be heard? Okay. Thank you, Dr.
We're getting feedback on a lot of people.
Is that better? Dr. Siddiqui, thank you. I'm not so worried about the second dose. I'm worried about the first dose. There is a problem here. As you know, it's not your fault. I can't get the first dose at Ryan. I can't even apply because the Ryan Center website, when you fill it out and you prove you're not a robot, nothing happens. So there is a tremendous problem here, and it's wonderful to know everything about it, but we can't, this community needs to get the first shot. I know it's not your fault. So my question is, what is Ryan doing to get more of a supply? And what can we do to help you to push? I don't know who's getting it, who's not getting it, but if you need help to push our electeds to get Ryan some doses so they can serve this community and protect this community, please let us know. That's a direct question. How are you getting supply? And how can we help you?
Okay. Yeah. So our supply is coming directly from the DOH, and I know you can, Dan Pinchton, our executive director, I think that's someone a lot of you know has been dealing directly with the DOH day to day. We probably have a phone call with them every day about how many we've used, how many we've gotten, and we're constantly asking for more. So the biggest issue is the supply.
New York State Department of Health, for everybody who's not understanding that.
Yeah, sorry, New York State Department of Health. The supply is the biggest issue, and our request went through the roof. Just to give you an idea, we don't have a lot of vaccine. We only got a few hundred vaccines, and our requests are, I think at one point we were getting 1,000 requests an hour. Like our email and our phone just blew up. You know, it was more than we can handle, and we had as you know, and we still are trying to operate our daily functions. We're trying, you know, it's not like we're scaling back our patient care, our front desk. So these same people that are doing our daily functions, we had to pull a lot of them to help try to get these phone calls and respond to these emails. So that has definitely been a struggle, and there is an overwhelming demand. So ways to help. So when we were first asked about how to, you know, about our needs in the vaccines, you know, we weren't aware of like how there would be such a supply and demand issue, and where we would lead our community. So we focused on our patient-based population, right? So because they asked us, how many patients do you have, and how many employees do you have? And that's how many vaccines you want. But now we see ourselves as someone we're not just vaccinating our patients or employees, we're vaccinating our community, people who are just going to register, come once, get a vaccine, and we may never even see again. So we're actually reaching much farther than, you know, what was, you know, for initially. So ways you could help is, I think, advocate for us. We're happy to do this work, but we need more vaccine. So if there's any way, if anyone has connection to channel it to us, but I mean, I think it's going to be tough. But yeah, that's really, it's the supply that we need.
But do you need
Doc,
more
just
vaccine
one
and more
more-
staff also to administer? Besides the vaccine, do you need more temporary staff to administer?
Yeah, we have some staff, and we're hiring to prepare for the ramping up. So we did prepare a little bit of that. But things like maybe tech support, helping with, you know, iPads so that people can register quickly. So we're, you know, so the populations that we work with, like I mentioned, these are the like literacy rate can be lower, understanding the internet and computer systems. So that probably takes the most amount of time, helping someone fill out the form and helping them get through the registration process, because there's a lot of new patients for us. So that's a place where we could use some help.
I just want to say, Dr. Siddiqui, the Ryan Clinton is just a terrific place, and you do a superb job. But this community needs help, and let's try to help you. Thanks.
Thank you.
Who's next on the committee?
It was Josephine, then Leslie.
Okay.
Thank you. Thank you, doctor, for being here. 2 quick questions. When will pediatric trials be completed and this vaccine safely made available to children 16 and under? That's one. And then the second one is, have there been any fatalities directly linked to the vaccine?
Yeah, so the last I saw that they are currently in the process of recruiting 16 and under for pediatric trials. So that's Pfizer and Moderna. And then the last trial, they followed patients out about at least 12 weeks, but they are going to continue following them out for 2 years. So information hasn't been released on how they plan to implement the next trial and how long they want to follow the persons out. It could be a little bit different for pediatrics. So I would imagine at least a few months, because you do have to follow out once the vaccine is given to get the data. So that takes at least a few months. They followed 3 months for the previous. And then the second question was, I forgot the second question. It was,
Have there been any fatalities linked to the vaccine?
so I would have to double check if there was direct links. I know there's been some things in the news and social media, but I always take that with a grain of salt because there's always so many pieces of the story. And so I am not aware, and I don't know if anything's been directly related to the vaccine. It's difficult sometimes because you also, with large, with studies, what we also have to take into account, and I was actually describing that to some of our staff, because the talk of things like Bell's palsy, you have to compare to what's the natural incident of a certain disease and even death. So if you have 30,000 100,000 persons, how many in just, if vaccine wasn't given, how many are expected to die in that, or to get Bell's palsy? And if the incidence is higher than what would be naturally occurring, that's when it's looked into a little deeper, that this would be, is there a correlation? I mean, it's looked into regardless, but that's one of the things that we look at is this out of proportion of what would naturally happen?
I think Josephine's also asking from people just being vaccinated as opposed to being in the study. Have there been any fatalities that have happened since the right? Josephine, since the vaccine
Yes.
started? That's what you're asking, right?
That, yeah, I'm
Right.
not aware of that.
Okay, so there's also, going back to the children, there's a possibility that we won't get kids vaccinated before the next school year then. If you're saying it's 3 months out, then the time plus, I don't know, it just seems like, I'm certainly not trying to rush the process. I mean, I want kids to be safe. Obviously, I want everyone to be safe. I know this takes time. I'm just wondering what your thoughts are about that.
Yeah, I think it's really unclear right now. So the first studies, so last year, the adult studies started as early as March, as some of the research and studies. So I don't know. I guess I
Okay.
can tell you just me.
Well, maybe considering we'll have a national policy, this might actually, something might move faster or more coordinated because it's clearly not been done so far.
Thank you.
Dr. Siddiqui, thank you for the presentation. My question is, do we have any sense how long the immunity lasts once you get the second dose? Is it 6 months? Is it a year? Is there any theory as to how long it lasts?
Yeah, that's still to be determined. Like that's like the answer to a lot of my questions is still to be determined. But the expectation is at least a year, maybe longer.
Thank you.
Other questions from the members of the committee?
I saw Hector's hand up, and then Judith, and then we have two from the public who I saw had their hands up. Oh, Betty too. Hector?
Yeah, hi. Thank you, doctor, for the presentation. It's very detailed.
If the question has been asked, if you could just keep it brief for everyone else who's going after. Thank you.
No problem. My question is, I understand that there is a sort of shortage on the vaccines, and I know we've covered that already. But what is the plan? I mean, is there a plan in place possibly for when new vaccines, like I believe the one from Johnson & Johnson, will hopefully be out in about a month or so? Are there any plans for those to be implemented on a wider scale since we're running short on this other vaccine? Because I believe the Johnson & Johnson is just one shot and it's 95% effective, supposedly.
Yeah.
Is there any comments on that?
I haven't heard anything concrete yet about when and if we'll be getting it. The Pfizer vaccine and Moderna vaccine, we only knew maybe 1 or 2 weeks ahead of time. It kind of just, we're like, okay, when, vaccine's coming out next week kind of thing. So I haven't heard anything yet, but that doesn't mean anything. They could tell us 1 week from now or 2 weeks from now, we'll have it. So I don't know.
Thank you.
Okay, thank you very much for the presentation. I would just like to ask your help with this concern. I went over and helped a friend who's retired and needed help logging in through the Ryan website. And we logged in and we got it all through the paperwork and we did all the et cetera, et cetera. And after she was done, after looking at other sites, this one allowed us to go through, it said no appointments available. Many of the websites already say no appointments available. And she was so disappointed because we got to the place where we could log in and she could register. If there are no vaccines, if you could change that to put no appointments available, that would really be helpful because my friend was very disappointed. That's just my comment on the website. Thank you.
Yeah, it's really tough working with some of the technology. I'll take that point back to our IT department. There's a lot of turnover. Like I said, there's very limited number of appointments, and things are constantly changing. So someone could cancel an appointment and then something pops up. Someone might find a vaccine somewhere else. So most of the time, I mean, at this point, because there's such a high demand, when you go through the online system, you probably will have a hard time, but there's going to be some of those lottery winners.
But Dr. Siddiqui, could we ask you to work with your tech people to put a banner or a flag when there are no appointments available, so people don't get their expectations raised, knowing that they. I'm just saying,
That's a good point.
Everything is sort of, we know how hard it is, right? Whatever you could do to make it easier to say no appointments available at this time, check back later, whatever. So it's,
Yeah. That's a really good suggestion to take back.
Betty, you had a question?
You're on mute,
You're
Betty.
on mute, Betty.
I guess so intense, Anyway, this was a wonderful presentation, and this is not really a comment directed to Ryan, and you're functioning so much. But since I'm in this committee, I just want to point out that New York City canceled 23,000 vaccine appointments, and they had a press release, and they said that they were going to email notifications to people who had appointments. Now, I had an appointment for tomorrow, and I never got a notification, so I did not know whether I was going to go. I had a Queens location to go to, and I got so frustrated that I contacted an elected official whose staff person kindly called the Department of Health, which an ordinary person can't do at this point, and said, no, your appointment is shifted by 1 week. I don't want to make a long story of this, but since this is the committee that I would say this to, there is a tremendous dysfunction with the Department of Health. Anyway.
Any other members of the committee?
Paul?
Yeah, Joe, Doctor, thanks for the presentation. Very good. I don't know why my picture is evaporated, but it has. Just a quick question. I don't want to wade too far into the weeds here, but I've heard that the longer the general population goes unvaccinated, till we get to whatever the magic percentage is, where some sort of herd immunity starts to help, the longer it takes to get there. I've heard that, or I've read, I forget where I caught it, but I've heard that it's more likely that there will be still more variants. And to your point earlier about one of the components of this vaccine being an RNA component that attaches to the spikes, this may all be baloney, I just don't know, but I'm just looking for a doctor to ask the question. You're it. Have you heard the same thing, that variants, for instance, I think it was the Cape Town variant, that these spikes are different and they bend to the left, to the side. So the vaccine may not solve that particular variant. Is this an ongoing problem? I mean, I know everyone wants to get vaccinated yesterday, but is this factual? Do you know?
Yeah, so there's a lot of conversation about this between virologists and those that have produced a vaccine. It's not a surprise in any way that the virus is mutating. It's common. The flu vaccine, not flu, but the flu vaccine, but the flu mutates every year, and that's why there's a new component, new type of flu vaccine every year. And it's very possible that so COVID-19 is part of a group of coronaviruses, and there are coronaviruses that go around that are part of the common cold, and they are known to mutate. When making the vaccine, they do focus on parts of the virus that is expected to not be as volatile, not expected to mutate so quickly as others. So there is some expectation that the vaccine should be at least effective for a year, maybe longer. But this is nature, and things change unexpectedly.
That's right.
All right.
True.
Thank you.
Thank you.
Thank you, Dr.
Thank you.
Siddiqui.
Yeah, I just wanted to say to Ryan that Clinton Housing has been working with Ryan in the past 3 or 4 weeks on vaccination. Clinton Housing was tasked with coming up with a vaccination plan by the Department of Health for our supportive housing, especially we have congregate housing, people are sharing apartments. And Ryan has been unbelievably helpful because a lot of the things we talked about today, where there are seniors or people who are mentally ill who cannot go through the registration process. We have Hudson Guild assisting. So there's a whole community coming around this to help people schedule, deal with it, and begin to get vaccinated, especially those who are the most vulnerable with multiple health conditions. So we really thank you for that because it's really made a difference. So I just want to say that publicly.
Thank you
So
much.
James, you had your hand up or, yep.
Yeah.
Yeah.
Again, I'll just echo everyone's thanks, Dr. Studiki, for joining us and sharing information on the vaccine. 2 questions. One, my understanding from minimal non-medical research, at reputable sites is that this is the first widely distributed mRNA vaccine. There have been studies, and I just wanted to make sure that my reading of that was correct. So there are obviously risks involved, but based on your medical knowledge and background, it's not a communicable vaccine in the way that other vaccines are made because it's an mRNA vaccine. Is that all accurate?
That's correct.
Okay. And then the other thing was just a sort of a suggestion with regard to what's been talked about scheduling appointments. This is a tough situation. Nothing's going to be perfect. I strongly urge some changes to be made on the tech side to facilitate the best, most efficient way of distributing. I think it's a great idea to put a banner if that's possible. But in addition, has it been considered to sort of look at what your breakage is, meaning that there's going to be a certain number of cancellations, as you said. If you're going to a restaurant, people cancel a reservation, you get to slide in. So maybe it could be considered to have like a standby list. And that way people can decide if they want to stand by because they may not get a vaccine, but at least you won't have any lost doses. So I understand that's the challenge. And I just wanted to throw that at you as an idea. And again, thanks so much.
Yeah, that's the biggest thing is we don't want to waste one vaccine, and that's been the balance because this vaccine is not an easy vaccine to distribute in the way that it survives. I guess the vial, once you open the vial, it's got 10 vaccines, and within 6 hours that's going to expire, and that's not with most other vaccines. We could put it back in the fridge and reuse it. So that's one of the big limitations. We want to make sure we have enough people lined up and we don't waste it.
James, from Clinton Housing, they've been coming to our buildings. We have a standby list just in case people don't show up to fill in, and they're called. And we also, remember, we have frontline staff and the same thing. So we have a whole list of people to fill in so there's never a loss because that's being insane in this issue.
Nelly, can you bring over Mike Noble? Sorry to interrupt if you didn't finish, Joe. Sorry.
No, it's fine. And then also Christopher LeBron, bring him over too so we can go right ahead, one to the other.
Yeah.
And sorry, Dr. Siddiqui, if I could just follow up. There's also been discussion of excess remnants of a vaccine in a given vial. I'm not sure if that applies to the Moderna vaccine, but I was wondering if you could address that as well.
Yeah. So I'll address the other IT comment you made. If anyone in here working for, you said, offering us some help, I would love maybe some IT help. Is anyone from Google here on this community?
No, but we can. No, but our community board can certainly arrange that.
That was one resource. Like really, some of this IT.
We can speak to the community affairs person from Google, who was our former assistant district manager and is always willing to work and assist. That's a great connection we can make.
Okay, that would be great. Yeah, so there is this extra surprise vaccine, the 11th dose. It's like a unicorn. Well, not so much of a unicorn, but for every 3 vials, we are able to get that one extra, and we've been able to give a few out. So there's days where we've scheduled 40 people. We have had this kind of backup list situation where we try to, like, for example, what Joe was saying with Clinton Housing, I'm sure, I think I knew there was a couple of extra doses, and I think you rounded up a few extra people.
Yep.
So there is, it does exist. And the question though, we're hoping is that with the second dose, we got to hope that the person that got that extra, the unicorn the first time, I know we round up that will continue with the second dose too. Yeah.
Thank you.
Mike?
Yeah, hi, Dr. Siddiqui. Thank you for coming again. A week ago, you responded to a message that I sent you on the patient portal. And it had, yeah, that's me. And you told me in response to my question about why my appointment has not shown up as an appointment, okay? I made it within a certain time frame, just before all this craziness happened, right? Before you got flooded. So I was expecting to see right after doing that yes, indeed, I had an appointment on the day that I chose within the parameters set on the website. Nothing. So I don't see an upcoming appointment or anything. And you responded to me and said, oh, look here, there's a waiting line, right? There's a line. And that you reached out to one of your colleagues to get back to me, to walk me through this. I don't need to be walked through it. I've already done it, okay? I need to be told where I stand in the line. Am I indeed in the line? I'm a patient. I did it through the patient portal, not from the outside, applying for the first time to Ryan. I've been there for a million years. And I thought that the way I did it would get me at least, visibly in a line. I would know where I stood. Okay.
Yeah.
So the question is, where are you in the line, right?
Yes. So your answer to me, I don't know if you understood that I was one, a patient, and two, that I had indeed done this process. The website's not telling me anything about that, either whether it went through or where I stand in the line.
I'm guessing it does not have the capacity. Is that correct?
It does not. Indeed, it does.
No. I'm asking Dr. Siddiqui. Yeah.
No, it doesn't. It does not have the capacity. And yeah, sorry, Michael, about the experience. I did get the message, and I passed it along to the coordinators. So I could follow up for you. I have your name here. About
I do this as sort of a lab rat sort of experiment. Okay.
the lab rat, yeah, kind of thing.
I've done this in other areas, and it works because sometimes you need face to face with somebody, who you're not going to see, to tell you exactly what's happening, on the ground. I will tell you this: I have an appointment at Mount Sinai, right, that I made before you all. And the reason I wanted to go to Ryan is because the Moderna vaccine is the one that I'm looking for. At Mount Sinai, it's whatever they have when you show up. All right. And I just feel safer taking it,
Hey, Michael, I'll go to Mount Sinai for you, and you can take my place at Ryan with it.
No, I'm just saying, but the point is, their website is a good example for you folks to get a look at. It works. I mean, it's telling me everything. I gotta.
Right, but Michael, let's step back for a moment. We know we're not going to solve the world tonight.
Yeah,
We're going to bring Chris LeBrun over in a second. What I want to note is what we're hearing and we're reflecting is we had no national infrastructure to do this.
Right.
And they cobbled together a process with our local community health center, not set up to do mass vaccinations, and they don't have even the technology to respond back properly. I think as a community board, our job should be find out what they need, find out identify the issues, and over the next 30 to 45 days, we try to get them assistance to get these things to work better. And that's everybody going across the board. So we're going to go to Chris LeBrun and then Dolores.
I'll yield my time to Dolores, and she's on committee, and then I'll speak after her.
No, Christopher, go right ahead. Dolores is relaxed.
Okay, thank you very much.
Thank you, though.
You're welcome. So, Dr. Siddiqui, thank you again. Really appreciate it. From a marketing point of view, I was looking at all the organic chemistry terms that you put on a slide telling us what's in the vaccine and what's not in the vaccine. Is there a way that you can produce a lay sheet that can be distributed so that way our community understands, like, just at the crux what's in and what's out? So, because there's a lot of concern coming my way from my tenants asking me what's in it, and I can't explain orgochemistry like you can. The second, so that's a request for distribution. The second is, you said you needed help with on-site registration with your iPads and that you need iPads. Is there a possibility that you can tap into the block associations in Hell's Kitchen so that way an email can go out requesting a volunteer corps to expedite this? If you're willing to, I'm not sure what kind of HIPAA signatures you may need, but if you're open to that, I'm sure the block association would be available to you. And then 3, from an IT tech point of view, yes, I totally agree that Google needs to be involved in this because you have a CRM problem and you need a system that automatically triggers when you're filled to capacity at scheduling. Your website needs to change to say, we no longer have time slots available at this point, but please provide your information, and you can take that in using your secure server and making sure that you're still applying to HIPAA, and turn that into some sort of like text message CRM response. So when things do open up, when you do get more shipments, or when you get more shipments and more timetables, you can immediately text message people or phone them with an automatic dialer that there's availability at the Ryan Center. That's all. I'm so happy that you do have the Moderna vaccine. Thank you so much, everyone. Thank you for your time.
And we just note that Christopher just gave you 17 technology things that you probably not will follow. And that's why we need to get you hooked up with a serious service technology provider.
Yeah.
Let's go to our next person.
Thank you, Joe.
Marissa Rodanti. Remind everybody we're at 7:25.
Wait, Dolores also wanted.
Yeah, but
Say
let's
something.
try to get.
Hi, it's really quick.
Okay.
Can you hear me?
Yes, we can.
Okay, the question is, when you get vaccinated, do you still carry the virus? In other words, we've been told the virus sheds from you, and it's not just, even though it's airborne, it's on other things. So I think it's important to know that once you've had your second shot, do you still carry the virus, like an asymptomatic carrier?
That's a really good question. That is still undergoing research. Last I checked, we're not sure, but it is theoretically possible that someone could be a carrier. So you'd have immunity that if it infected you, your body would fight it off, but could you be a carrier on the surface? That could be possible for a short amount of time.
The reason I ask is that people will need to know they are not out of the woods for the rest of the community once they get vaccinated. Because everybody wants, if it's in your pod, apparently you're more safe. You can hug your kids again or whatever. But this is so important. We just did 1,000 vaccinations here, and we used a calendar.
At Manhattan Plaza.
Right. And so all those things were coming up. And also the calendar thing worked beautifully. And doing the paperwork ahead of time was the key. We had no lines, and we did 1,000 people in 2 days. So anyway, if anything, the Actors Fund can tell you what we did, but the Ryan Chelsea Clinic really needs help. And I'm wondering if we could ask the Actors Fund, Joe, to maybe help with some iPads for them.
Yeah, I've been taking notes throughout the whole meeting so far, so we get together a good letter and then put it out there. Can you bring over, thank you, Marissa.
Thank you.
Bring over Elka Samuel Smith,
She's
last member of the public, and then we'll go to Dolores. Go ahead, Elka.
Elka.
Unmute yourself.
Yes, hi. Sorry, I hadn't realized that I was unmuted. I had stepped away for a moment. Good evening, everybody. My name is Elka Samuel Smith. I've been a long-time Hell's Kitchen resident, and I have 2 children in local schools. I'm just kind of wondering what kind of progress or advocacy has been made towards the we've had like several shelters moved into hotels in the neighborhood, and we've always had shelters in the neighborhood. That's a part of our fabric of our community. We have everything, but we've had shelters that require people who need services, and it's very clear that those services have not been provided to them, and it's kind of like made the neighborhood really unsafe for many of our families. We've had tons of complaints. I'm the PTA president over at PS51, and I'm also on the SLT at HSES. And it's just really concerning in terms of the safety of our community. It feels like the cops went from over policing peaceful protests to doing absolutely nothing in our neighborhood
Elka, let me interrupt you for 1 second. We're going to take this matter up later in the meeting, so can you please hang in there?
Oh,
Yeah, it's actually on the agenda to discuss. But if you have anything else about the vaccines, we want to wrap up this first part.
oh, sorry about that. I wasn't sure about the format, so
Yeah.
newer to these meetings, but
No problem.
thank you. Okay, will do.
So thank you so much, and don't go away, because we're going to talk about it extensively.
Okay, no problem. All right, thanks.
Let's go to Dolores next.
Yes, Elka, stick around because this has been a conversation for the community for many months, and we're working on this. Joe, you know I normally advocate for writing letters. In this particular instance, I do think, however, as things are extremely fluid, you have mentioned that we may get a national plan. I don't know how effective a letter would be. I think the board itself may be more effective in using the channels that we normally do to liaise with our local electeds directly, to liaise with the community partners that we already have. My concern is that anything that we memorialize will really be outdated. But my main concern right now is the Ryan Center has been a staple for the community. And what I'm hearing is that those that are already patients of the Ryan Center may feel that they're not having the access that they would expect for the vaccine because you're having to accommodate a broader community. What I'd like to ask is that if there's a way to provide, with whatever assistance you need, more support for your existing patients. So if you have patients that are already coming in for their normal physical or other exams, you mentioned you're doing most of your vaccinations at different times. Perhaps there's an opportunity with your normal patients to see if that 11th dose is available or an open space to ensure that your normal patients are still getting access to the vaccine and not having to go ahead and get crowded out by the rest of the community that is trying to get the vaccine. So that was something. So Joe, I don't know what the rest of the committee's thoughts are on writing a letter because I'm just not sure how effective that will be. We already have channels in place to go ahead and ask the questions we need to ask, but just throwing that out there.
Yeah, I'm going to suggest we're going to do both, but we should write a letter to memorialize the actions we're taking. The list I'm making is really for the district manager to activate and engage with folks, but knowing that it always helps to memorialize what we did. We should not be waiting 30 days for this, obviously. So I'm on the same wavelength with you, Dolores.
Thank you, Dolores, for bringing it
I
up.
will make a motion that, Joe, that you write a letter that may or may not be effective by the time it gets out, but that we memorialize the major concerns that we've talked about in terms of communication, technology, support for the Ryan Center to be able to handle the technology, as well as the point I just made about existing patients, as well as just overall thanking the Ryan Center for providing this information to the.
And the two major thrusts would be to contact our assembly member, who's the chair of the health committee in the assembly, Dick Gottfried, and to then also work immediately with Google to see if they can assist them with the technology part, because that will help just get the expectations managed. And there, by the way, a plan was released today by the Biden administration. It's 200 pages long. No one's got to read that yet exactly, but I think we're going to go into overdrive on this. And the last thing we want is for our community health centers, which are noted a lot in that plan, they need to have the infrastructure and the staff to manage it. Otherwise, we're in up Schitt's Creek. That's a technical term for, yeah. Well, so Katie, is there anything on this motion?
Yeah, I just had a question. I wanted to make sure that that the motion captures reaching out to the Department of Health as well to say, to put on record that we are asking for more vaccines being made available to our, I just want to make sure that that part's captured.
I got it. Yeah, I had that to begin with. No problem.
Marvelous.
So all those in favor of Dolores' motion. I'm assuming this was a quick second.
I second it. I second the motion, but I just want to emphasize the distribution of these vaccines. I don't know how it's done, but I want our electeds to push for us. I don't know if they're distributed equally from anecdotal evidence, so I think we should encourage our representatives to look out after our community health centers.
Yeah, I
Thank
just
you, JD. So
that a little bit. As a lot of you know, the Ryan Center, we are in the neighborhood for a reason. It was built over 20 years ago because it was determined that that was a needs community. And of course, the neighborhood has changed over time, but our mission is healthcare is a right, not a privilege. And we do know that this virus and disease has affected populations disproportionately.
Right.
And we see our role, and it's shifted over time because we had to prioritize certain populations, which was type 1A and
right.
But we really see our role as to be there for that, to continue serving that community at the forefront, because we realize that we're the best equipped to do that with our experience, with our neighborhood, with our training. And, you know, I also really want to support that the city is going to, you know, if they open up their centers in Javits Center and a lot of people could get funneled there. And we really want to focus, like how Dolores was saying, our patients, our community, and then the most vulnerable. If we're at a limited supply, that's what we do best. And then if we get more supply that we could do more, we want to do more. So it's, you know, it's kind of like a hierarchy of what.
We thank you very much for your work. And I want to note to the committee members, we budgeted 20 minutes for this discussion. We knew it'd go over.
We did.
We're at an hour and 3 minutes. So let's move to our next discussion, Maria.
Wait, Joe, who's writing that letter now?
Time. Huh?
Who's writing that letter now?
I have the notes. You're welcome,
Okay.
Maria.
I am gonna watch some of this, have to watch some of this on YouTube. But JD mentioned representatives and elected, so I just want to shout out that I saw Brian Lewis on the call from Manhattan Borough President's office, Carl Wilson from the Speaker, Emily Bartasak from Linda Rosenthal's office, and Luke Wolf from, I forgot.
Scott Stringer.
Scott Stringer.
Thank you.
And Matt
Scott
Tighe from some member Gottfried's office.
And Matt, thank you. I knew I was forgetting somebody. So the next presentation is from Center for Court Innovation, Midtown Community Court. Basically, Midtown Community Court helps to address low-level offenses by providing alternatives to fine or incarceration for low-level crimes through social service programming. Midtown Community Court is piloting Midtown Rapid Engagement Initiative, which is a collaboration with Midtown North for services needed post-arrest. And here to talk about it is Sarah, the clinical director. Sarah, where are you? I know you.
And Sarah, thank you for waiting.
Thanks for being here.
Hi, everyone. Thank you for inviting me. I'm Sarah Blanco, the clinical director from Midtown Community Court, and also on behalf of Midtown Community Court, we're really excited to share this initiative for you. So this is Midtown. This is a community engagement event we had recently where we passed out food to residents within the community. We can talk about that some other time. I know we're limited on time. So if we could just move to the next slide, please. Thank you. Well, the one right above it. Yeah. Okay. I just want to give everyone a little background in Midtown Community Court. You may or may not be familiar with it. Most of you are familiar with the area, so I'm making some assumptions that you've heard of it, but it's part of Center for Court Innovation. It is Midtown Community Court on West 54th Street. It opened in 1993, and the idea was have an alternative way to deal with low-level crimes in the area. Through social service programming, really targeting the root causes and providing the needed programming to prevent re-involvement in the criminal justice system. And we've been really, really successful with forging relationships with community members and our clients to really have client voice and community engagement and community involvement. We can move to slide 2. So as Midtown Community Court evolves, and as we revision and vision what we're going to look like in the future, we have some new initiatives. And really the focus is rethinking criminal justice reform by creating more upstream restorative justice approaches and using interventions that assist community members prior to police involvement. So upstream meaning we'd like to engage community members and before they have to get engaged with the the criminal justice system through community engagement, restorative justice practices, community building circles. But we also, the focus here today is the Midtown Rapid Engagement Initiative, which we can move to the next slide, is a collaboration with multiple community-based partners, including Ryan Chelsea Clinic, who's here on the call. We're a huge fan of theirs. Fountain House, who's not on the call. And I'll get into more of the partners later. But the Midtown Rapid Engagement Initiative, like how is this idea started? How is this envisioned? Well, it was response to bail reform that started in January 2020, where people who were arrested previously might have been detained or held into arraignment. Their arraignment time, and that could have been days. And at that point, we could engage people in social services, but now people who are arrested for misdemeanors or level felonies are given a DAT, which is a desk appearance ticket. So basically they're arrested, they're given a desk appearance ticket to return to court, Midtown Community Court, in 21 days. And what we've found and what research has found that people who interface in the criminal justice system and have frequent contact, there's more complex issues going on. There's homelessness, mental health issues, substance use issues, lack of access to services. So it's more than just this transaction of like a crime has happened. There's deeper root causes. So the Rapid Engagement Initiative proposes, in strong collaboration with Midtown North Precinct, that is we're right beside the court, that we are working collaboratively. So any client who is arrested and given a DAT, Midtown North officers can say, hey, are you interested in social services? And if a client is, they can call us directly and we can walk over. We have a rapid engagement team, which consists of social workers, a peer navigator. We hired from Fountain House, case managers who can meet the client in front of or near the precinct and say, hey, like, this is the program, are you interested? And the person could say, actually, no, or yeah, I want to learn more. Then we would walk them inside into Midtown Community Court and do a needs assessment. What are they interested in? What are their needs? Are there imminent crises or concerns that we can tackle? And the idea is to rapidly engage them with critical services immediately so they don't fall through the cracks. So they, as a preventative measure, they can get the treatment or services they need, but also to provide case management and wraparound services so they do show up at their court date 21 days later to prevent a warrant. Past the 21 days, we can certainly follow. We're happy to follow them on a voluntary basis and continue to work with them to address the needs that they identify and want. We're hopeful that involvement with the Midtown Rapid Engagement Initiative and our community partners could result in a better court outcome for the client. We're still working on that, so there's no guarantees, but we do think that any sort of, like when we have a client and they're in a period of crisis, maybe post-arrest, maybe they're in detox because they've been they've been getting a DAT for 4 hours. We feel like we have the community-based partners and we are all going to work together to get this client engaged in services. So this is the start of our kind of an upstream approach to prevent the involvement. And then we have other programs to prevent re-involvement and provide needed services. And then we have other initiatives moving forward to prevent criminal justice involvement and police interface altogether. I think the key component in all of this is our commitment and understanding of what is happening with our clients and people who are being arrested in your community, and Midtown North's commitment to working with us to make this happen, along with Fountain House, Ryan Chelsea, Breaking Ground, Housing Works, who have all made commitments that we kind of like have a bat phone that we can call them. We can walk people over directly to appointments if someone needs MAT or some sort of medical services. We have the capacity and the bandwidth to make sure not only we make appointments, but follow through, do check-in calls, walk people to services. You can go to the next slide. And these are some of the services that we're really highlighting: mental health, substance use, benefit assistance, housing assistance. We're also, if we get a call, some of our some people might be eligible for pre-arraignment diversion programming through Reset or Project Hope. So we can do that rapid eligibility check. So the person, if they are eligible, they might never have to go to court at all. So that's another kind of service that and off-ramp that we can offer. You can see the partners listed. Fountain House is unique because anyone who's interested, they're offering a special program called On-Ramp for folks who might have some mental health concerns, and anyone interested in that program will be given a tablet so they can engage with the On-Ramp program at Fountain House, do their virtual programming, and then we can stay in touch with them to make sure not only do they show up for court, but how are they doing? Like, are they attending their appointments? What else can we do? It's just a further extension to make sure we can stay in touch, because we know a lot of the clients that come through the precinct and in our community are homeless. They don't have access to technology. There's just a lot of instability in their lives. We know in the Midtown community right now, there is, well, across the city, we've read the report that overdoses have increased in 2020. And we're also paying a keen attention to that to make sure we can address that in the community with naloxone kits and trainings. We can go to the next slide. I think that was kind of a quick kind of overview. If you have additional questions, you can certainly contact me and I'll put my information in the chat. But you can contact the program director, Lauren Curatolo, and email her as well for any questions. Again, the purpose is to make sure we can link people to services in a time of need and not let them fall through the legal system and in cracks again. And we have a lot of experience with this. So I just think we're well equipped, especially being next to the precinct, to really work together and ideally maybe expand it to other precincts and expand our catchment area. But it starts off the initiative with clients who are arrested at Midtown North and who are taken to Midtown North for the DAT.
Thank you so much, Sarah.
Yeah.
And Nellie, can you put the contact information in the chat?
Yeah, absolutely.
Okay.
And I saw that Dolores has her hand up already. And then JD.
Hi, so big fan of the court, which is directly across the street from my house. I remember when it was the YMCA and then also a Grow Through Art Museum experience for a few years before you were a court. I was hoping that you can give a little bit more detail to the community on whether or not any of these programs that you offer are offered to other folks in crisis, or only folks that have been arrested?
Yeah.
As well as, is it voluntary? If there is an arrest made, can the person who's arrested be required to use your services? I think it's important for folks to understand how you work, because what we've seen is since bail reform, one of the major things we're hearing at the police precinct council meetings over the last few months is that a lot of repeat offenders who understand that they can go back to their business even after a cop has made an arrest and made the case for why someone should be detained or kept, et cetera. So trying to figure out where that balance is and where the court fits in terms of reducing the recidivism.
Okay, so let me, that was a lot of questions. So let me make sure I can address all of them, and please prompt me if I don't. So this is a 100% voluntary service. How NYPD it's offering it to everyone who's eligible for a DAT. If the client is interested, then they can call us and we'll meet them outside to introduce ourselves, offer the services, and see if they'd like to pursue them. The client also, I'm a social worker, so I'm participants, clients, individual citizens. If the person is like, right now I'm not interested, we always would give contact information because it's not a one-time offer, right? We're an ongoing offer. And for, even if a client just was like, I'll give you my name and number, but like, I really don't want to pursue this right now, we would probably, we would check up and just say, hey, are you interested now? Or just a reminder, your court date's on March 14th, like, please show up. Is there anything that we can do to help you show up? Like, what's going on with you? And as far as voluntary services for the community, yes, we do offer voluntary services to the community. What we offer in-house is some short-term counseling. We have harm reduction groups. We have a community naloxone training, a community naloxone group we can offer. And we're trying to build out other programming, but we do have voluntary services, and we have always offered services to the community, but we're trying to expand that vision and make it more public. We are very engaged in restorative justice programming right now. We have received, luckily, funding. We no longer have holding cells. Well, we have holding cells at Midtown Community Court, but they are going to be transformed into restorative justice spaces. Now, that requires construction and time and everything, but that is going to happen. So we really are trying to view ourselves not just as an arm of the court, but as embedded into the community. We also have a fatherhood program called Up Next. We're non-custodial fathers. You don't have to be involved in the court at all to be part of that. We have amazing community engagement and community service programs that you could volunteer for that have become really innovative during the time of the pandemic. It's all virtual, but letter writing, listening to podcasts and engaging in deep dives and dialogues about current topics, defund the police, mass incarceration, community building. What does it mean to be a community leader? And we're always open. Every month we have a community conditions panel. So that's virtual right now, but we always welcome community members to come. And if you're interested, let me know and we can put you on that listserv to talk about what's happening in the community, what the community needs are, and what you would like to see change or happen. We're really, I think Midtown is like, is it 2021? I don't even know what year it is because time has like stopped. But we are viewing this next year as building and growing and adapting to what is what has happened over the changes that have happened in the political and criminal justice environment over the past year.
Thank
Great.
you.
So just a little plug, would love to have you come to the Midtown North Community Council meeting and also provide the same presentation to the folks that engage in that space.
Absolutely. My email is in this chat. You can always feel free to reach out to us. I think we're trying to really get our name out there, especially with this initiative and other initiatives we have.
Well, this is the way to do it.
Yeah. So thank you. Please.
You're welcome.
Welcome.
JD, I think you had your hand up.
I do.
And then I see Jessica and Leslie.
Thank you, Maria. Thank you, Sarah. The Midtown Community Court was very much a partner with the block associations and this board back in John Feinblatt, way before your time. So we're very engaged with the court, or we had been, and it certainly is a wonderful thing for this community. I have a specific question. I don't know if you can answer it. There has been some concern expressed about the number of residents of shelters in different boroughs being put in the Hell's Kitchen neighborhood. And one of those questions came about parolees. Certainly parolees deserve the same breaks as we all do. However, there was some question about parolees who might have had a violent background and being put into some shelters here, maybe 3 or 4 in one particular location. My question is this: if you're a parolee and you have a parole officer and you're originally located in the Bronx, say, does that, and you're moved to Hell's Kitchen, does that parole officer come to Hell's Kitchen to make checks with the parolee?
I mean, especially right now during a pandemic, and what Midtown does is we only deal with misdemeanors. So we're not dealing with, a person could be on parole, but that's just kind of out of our jurisdiction. But I will say with past experience in other jobs, and please fact check me on this, and I'll fact check myself, that if you're on parole, you have to let your PO officer know whatever your location is so they can find you. And my assumption, again, fact check me on this, is that if you're being moved to a hotel out of your borough or out of what's been approved, your parole officer would have to approve that. And in order to get in the shelter, there would have to be some notification of approval. But I think that, I'm happy to look that up and do a deeper dive for you to research it and ask people who are more engaged in that world.
Yes, would you please? It is a concern. They need to be, talk to their parole offices. But
yeah.
Thank you very much.
Sure. Thank you. Jessica.
Yeah, thank you. I was just the model, and I just consulted the Wikipedia page, and it seems that this has been replicated in other cities, but not, I think, in other areas of New York. And I was wondering if, I know we're tight on time, but maybe you could just say a minute about like, why isn't this expanded or replicated, or any insight into that, or a place you can direct me to look to read more on that.
So I will say, as far as I know in New York City, this is the initial, we're the first pilot or initiative to do this. In other parts of the country, there's been similar programs, and you could look up in Eugene, Oregon, CAHOOTS, CAHOOTS, which is a similar model. I don't really know why this hasn't been done before. I know there's Project Hope, which is a pre-arraignment diversion program. So if you're arrested on a 22003, which is I believe it's a drug possession charge, instead of going to court for arraignment, you're diverted to programming. And then once you complete it, you're pretty sure your case is dismissed or declined to prosecute. We also have Project Reset. So Project Hope, we don't have at Midtown, but Project Reset, we do have at Midtown. So if someone is arrested of one of 17 charges, Danny will determine if they're eligible for reset and contact us. And then they can do a 2-hour group based on restorative justice practices, accountability, being a community member. And then that charge is declined to prosecute. So there are pre-arraignment diversion programs that are existing, but as far as I know, something like this post-arrest, rapid engagement, at least in Manhattan, I'm not aware of. In Oregon and California, yes.
Thanks.
Okay, thanks, Sarah. Leslie's up.
Just so you know, the two things that are missing here, there needs to be political will to do this and funding for it. So we were very lucky to be a major demonstration program early on. A whole bunch of folks that we have worked with, John Feinblatt, Amanda Burden was involved in this. This was a major event that we did as supporting a community. So hopefully, as the world changes, this becomes more of a model that gets used. I think that's why you don't hear about it that much in New York City.
Yeah.
Yeah, and it took a while for you guys to even get approval.
It did. We have the green light from NYPD. And I think right now we're just trying to figure out how to operationalize it. We have all the staff, we have all the parts and the plan. I think we're just trying to operationalize it amidst the pandemic. So it's happening. It's going to happen. We don't have an official start date, but we expect it to be in the very near future.
I thought it started this week.
No, so that's another. So next week we have another Community First initiative that is rolling out, and that's doing street outreach, and we have partners with Breaking Ground, Fountain House, Times Square Alliance to engage folks who are in need in the community. Really focusing on people who might either be homeless, under the influence, need assistance connecting to social services, mental health services. So that is a different project that starts next week. This project is post-arrest. With the idea that we form these strong relationships with NYPD and the community. So instead of calling 911, they're like, call the rapid engagement team.
Yeah. Thank you, Sarah. And I know Joe was about to mention, let's check time.
Yeah.
And Leslie's about to ask a question.
Quick question.
Then Nellie, can you just bring over, I saw Marissa Rosanti and
Michael Noble again.
Mike Noble.
And I caution everybody, keep your questions clear and concise. Thanks. Go ahead, Mike. Go ahead, Leslie. Sorry.
Quick question. I'm not sure as to the status of Midtown Community Court. Is it a public entity, a private entity? How is it funded?
So it's a project of the Center for Court Innovation, but we're also a joint project with the Office of Court Administration.
There's also a lot of information on the website about that, where their funding comes from.
So we get a lot of OCA funding. We're staffed by OCA officers. So we're a branch of the New York City court system.
Got it. Thank you.
Yeah, super interesting. If you get a chance, do look at their website.
Yeah, to make this a little clearer, it's a branch of court administration with a bunch of private funding that supports other programs. So it's a public-private sort of thing. That's how
Yeah.
that's how it works.
Which works.
It's always worked that way.
Thank you, Joe. I appreciate that. No, I'm a year into Midtown, and so like, thank you.
Yeah, no, I was there when it was set up, so trust me, we all struggle with that. Let's go to Marissa Rodanti and Michael Noble.
Sarah, hi. I think I heard we discussed this way in August, or no, actually in June. It was, so this hadn't started yet, right?
No, it hasn't.
I remember this title of it, and I remember, and the only question I had was similar to Dolores's, is you have to be arrested. And a lot of the problems we seem to be having the same kind of problems is sometimes the drug dealers, they want the ticket. They want the desk appearance ticket because they're just going to go back to work on the corner. So I you know, there is that one little donut hole, and I'm wondering if you guys, I think this other program you're talking about with Breaking Ground is going to maybe solve some of that. Is that what's happening?
Yeah, I mean, you're right. There's always going to be people who are not interested in receiving services either post-arrest or pre-arrest. I think that is the donut hole, and I think we can try to be innovative and creative together to see what we can do. But this is post-arrest. The other program doesn't involve NYPD at all. It is street outreach workers in conjunction with Breaking Ground and Fountain House to work with folks particularly in the Times Square area.
Yeah.
Who are at the highest need of services, and our engagement is going to be consistent. So we have a presence and we can build those relationships, and also so the community can call on us and say, this is kind of what's happening.
Thank you. That is fantastic news, because that was the one thing I was worried about, and Dolores already pinpointed it. It's like you have to have an arrest.
Right.
Thank you very much.
Right,
Yeah,
but what I want to say to everybody, remember, the court was set up to act primarily as a diversion program and provide social services as an alternative to incarceration. With the bail laws changed, there's a whole different dynamic that's happened. But and so therefore, it has to be reinvented again to a certain degree, because there's no incentive. If you were going to face a jail sentence for whatever time, and you can instead get services and do some community service, you're going to do that. So we have to figure out how to make it work now. Let's go to Michael Noble next.
Thank you.
Yeah, and thanks for coming, Sarah. I just want to clear something up. I don't know if Jessica's question was related to community courts specifically or to your program. You know, there is the court in Red Hook, right? Which has been around for at least 18 years, because I lived there when it started, and it works great. They just extradited that woman from California and arraigned her there on the DAT, which is amazing. So your service, is it one that exists in Red Hook as well?
Yeah, so Red Hook is a sister site. So Red Hook is a program of a Center for Court Innovation. So we have the same kind of mission and function, but our community definitions, our communities just look very, very, very different. But yeah, so I live down the street from the Red Hook Community Court. I know it very well. Yeah,
well,
so we're sister sites.
Oh, good, because it really works well. I saw an operation and it works really well. So thanks for your help.
Yeah.
Nellie, can you bring over John Chalice next? Unmute, John.
Hey, thanks very much. Just one quick question. So this is a pilot. How are you guys going to measure whether or not it's successful?
So we have metrics that they're pretty much established. I think part of the pilot is establishing how we're going to measure success, but I think what some of the metrics are: does the person return on the court date? How many people are referred to us, and how many people accept services? How many people accept services and then meet certain milestones? Say they're interested in mental health services. Do they actually go to the appointment? If they're interested in substance use services, do they go to the appointment? Or if not, how long do they stay engaged with us? So we're really looking at this as a primary point of engagement. And I would say the two major data points is how long they stay engaged, what milestones do they achieve? And they're determined by the client. I will say we're not here to say this is what you have to do. What do you want to do, and how can we help you obtain that goal? And then court appearances.
And you'll use longitudinal data as a control.
Yes.
Got it.
That was a great final question. JD, go ahead.
Yeah, I'm sorry. This is important, I think, to say. The community court is a community court. And when it was set up, one of the problems we had was tremendous street prostitution in Hell's Kitchen. The prostitutes, the women would be arrested, they'd go downtown, and they'd be released, and they'd come right back. So the community court was an effort to consider the community also as a victim of crime. There used to be an impact panel, which many of us would attend, where the Johns would come in and we would say, hey, you're hurting our community. I want to emphasize, and Sarah, please remember, this is also for us a court that helps the community and deals with the community, as opposed to a downtown court that does not care about the community. That was part of its mission, and I hope it still is.
100%. That is the mission. Sorry, I didn't mean to cut you off there. I think I got excited, but yes, this is 100% our mission. Our community has shifted. The Midtown community has changed, right? A lot from 1993.
Not recently.
No,
not recently.
We're back in the 70s, I think, for some of us anyway.
Yeah.
That's sort of a good lead to our next
Can I just have
agenda item?
I'm sorry, can I just have one more plug? We have a community conditions panel. Please reach out to me if you'd like to attend, so you can highlight what you are seeing and is happening in that community, because we want feedback. And
I think you should stay on for the next item.
Okay.
Great
That
segue.
community condition, yeah, that was a good segue. And thank you, John, for your question. I was going to ask something similar. I don't need to. And I was going to say, I'd like to, if you guys could come back in 6 to 12 months to talk about the data that you've gotten. I saw that face, Sarah.
No, my face was yes, absolutely.
Okay, good.
I want to know that. I want to share that data.
Okay, thank you.
So our next item on the agenda is a presentation from the Hell's Kitchen Neighbor Coalition, and both myself and Maria are conflicted out. So we're turning over the chair to Betty McIntosh to lead this. And then there are 2 members to present, Betty Travis Rogers and Brian Weber. And Nellie, if you can bring those over. And then Betty, I turn it over to you.
Okay, thank you, Joe. So I just would like to point out to everyone on the committee that 2 things were put in the Dropbox for committee members. One is a mission statement for this organization. It's just 1 page, so you may want to pop it out of your Dropbox. And the other is a letter to elected officials asking for a meeting. So without further ado, let's start the presentation.
Yes, sorry, Joe, you said the names too fast. Who am I moving over?
Brian Weber and Travis Rogers. It says Brian W. on his thing.
Also, I should say the usual process we'll use will be members of the committee ask questions, and then members of the public can ask questions, and then there's a discussion, and then I guess there will be a decision about these documents. So who's talking first? Brian?
I guess I'll go first. That's okay with you, Brian?
Yeah.
Hello, everyone. My name is Travis Rogers. Brian and I are here representing the Hell's Kitchen Neighborhood Coalition. The Neighborhood Coalition was formed in the wake of COVID-19 and some of the drastic changes that happened to our neighborhood, particularly the influx of temporary shelters and residences here in the hotels within our neighborhood. That's kind of created a great burden and public safety and public health issue for us in the neighborhood. We've been inundated with uptick in crime, and uptick in these temporary shelters that has really put us under pressure. The neighborhood itself has always been a welcoming neighborhood and a very diverse neighborhood that has been willing to work with numerous shelters throughout the years. But the shelters in particular that have come in have been poorly run and been poorly organized and have not been clear about some of their operational standards. And so we're asking for more accountability on their part. We're asking for more social services to the temporary population that is here. We've all witnessed a number of them definitely out in the street having with are clear mental breakdowns and are definitely in need of services, and this is clearly not being provided to them. And so we want to work with the community board and our local politicians and public safety officials to kind of address these issues as soon as possible. I think for the most part, as Elka actually addressed earlier in her question, we have a number of children that don't feel safe. We have parents that don't feel safe and elderly residents that don't feel safe. So we want to compel the city to do something to really alleviate us of some of the issues that are currently taking place.
Thank you, Travis. Brian?
Yeah, I just want to add two things to Travis, which was quite a thorough explanation of who we are and what we're doing. The Hell's Kitchen Neighborhood Coalition is a very broad coalition. We're comprised of block associations from the West 20s all the way through the West 50s. And a number of businesses, local businesses, the Garment District Alliance bid and the Hell's Kitchen and Hudson Yards Neighborhood Alliance bid. And the other thing that I do want to point out is we've been advocating for a reduction of the number of shelter beds within our community district. Our district received a disproportionately large number of shelter beds, in large part because of the abundance of budget hotels that we have throughout our district, within the theater district and within the West 30s. And I think, as Travis commented, we've been reeling from it ever since. Many of you also know me as a public member of Community Board 4, and also as the co-chair of the West 36th Street Block Association. I've come before this board and I've come before the full board a number of times to talk about pressing situations in the West 30s. But I want to emphasize that these issues that I discussed in the 30s are being experienced by our neighbors throughout the West 40s. And one of the things we'd like to discuss is public safety corridors in highly problematic areas as we continue to deal with the temporary shelters in our neighborhood.
Brian, would you like to explain what a public safety corridor is?
Well, it's an idea that Joe, do you want to kind of talk about it? Because it's an idea that I've learned about through Dolores and Joe, but it's, you know,
you're
for
on mute.
example,
Pass it to Dolores and then I'll pick up at the end.
Okay, Dolores, you take it.
So full disclosure, I also have been participating as a member of the Hell's Kitchen Neighborhood Coalition. So I also am conflicted out. But the idea of a corridor is just, we're recognizing that as both Brian and Travis mentioned, this community, this broader community has received a larger share of relocated shelter residents. We don't necessarily have evidence that the issues that we have are specifically shelter residents, but what we do have within our community is now a presence of activity, which is a safety issue. We have seen more drug traffic in the area, as now there are clients or customers for that for those drugs that are coming in. So there are people preying on some of those vulnerable populations. We are also seeing there is some evidence of other types of illegal activity. And as was noted in Elka's comments when she first was speaking, it seems as if initially there was police activity on these issues, and we're not seeing it now. A lot of that is in response to the unrest around the whole country. But what we recognize is this corridor, the idea of a corridor, is looking where these hotspots are, trying to be very specific in identifying what they are and working with all the stakeholders to figure out how to reduce the public safety issues. That may be policing, that may be working with the actual providers of a particular shelter, that may be working with other social services groups to flood the area with more social service activity or offerings, et cetera. we don't know, or we're not prescribing what the solution is. What we're trying to do is to get people in the conversation so that there is a very specific identification of what the problems are, and trying to go ahead and find the best solution that makes sense for all of those that not only are permanent residents within our community, but those that are now temporary residents within our community.
And to piggyback off of Dolores's point, I think the city did a great disservice by placing so many folks in an area that particularly had some issues, because they became prey for drug dealers. If I know where all my customers are at one time, it's pretty easy to market and target my group. And the city just left them here to be prey.
Okay, thank you, guys. I think Joe has got his hand up.
Unmute Joe.
Still muted, Joe.
Damn, never gets me. Public safety corridors, we used to do this. It brings us back to like 25 years ago. We would have various buildings that had a lot of drug activity or prostitution. And then the community would get together and work with the precinct council, the local precinct, with social service providers, figuring out how we can temporarily put more resources on a certain area so it could be watched and managed pretty much. Now, we all know that the shelters are not going to move away in a day, and the problem is not just the shelters, it's the shelters plus the street crime, plus the mentally ill, homeless on the streets, all interacting together. And what we keep hearing back from the coalition is that people are afraid to walk on the street at night at a certain point. Clinton Housing, I represent Clinton Housing on the coalition. We have hundreds of tenants who are constantly nervous about just walking, in this case, 10th Avenue from 47th to 52nd Streets. That's one of the corridors we're going to propose. We need to just bring some more sense of public safety to that location. And we believe that by everyone working together, as we're managing the shelters and getting folks back to congregate living, that it'll help it to make people feel just more safe.
Okay, thanks, Joe. So is the HKNC presentation covered? Are we ready for questions? Okay, so I'm going to try real hard to get you in the right order. So who has a question? I'm not, Katie. No?
Thanks.
Katie.
I guess my question is, because I'm a little unclear. So I understand the specific recommendation or request that that these sort of public safety hotspots be identified, and that then there be a group discussion or a broader discussion about how to help these public safety hotspots, which I think is an awesome idea. I'm a little unclear though about sort of what else is being discussed, because what I thought I heard at the beginning of the conversation was a specific focus on wanting to compel the city to have fewer beds in our district. So is that part of this discussion as well?
That Katie is actually moving along on a separate track with the elected officials to figure out how to manage the deconcentration, the eventual transition back to shelters. That's from a broader elected official thing. We're here tonight to talk specifically about the public safety part of it. And we certainly can respond on other things, but we felt that was a much broader discussion than just this limited request.
Yeah, I mean, to piggyback off what Joe is saying, that's happening concurrently. And that's an ongoing thing. I mean, obviously, it's something in motion at the moment, with the availability of vaccines and, questions regarding what is the city's program for moving people back to congregate settings out of temporary shelters. But in the meantime, as we heard from our presentation from the Ryan Health Clinic, from day one of the vaccine till when you have enough antibodies, something like a 6 weeks period. So even if all of the shelters, all the residents and all the shelters were vaccinated today, we would still have to get through another 6 weeks. And I think in one of the meetings with the board, I said, it's hard to get through another 6 hours in this neighborhood. So the conversation that we're having here today is about public safety and what we can do in the meantime in working with local precincts and our elected officials to bring back and restore a measure of safety on our streets.
Yeah, and I just want to make sure that we are all being really clear with each other about what we mean by, public safety. Because if the definition of, I just want to make sure we're being clear. So it sounds like you're just saying we want to identify these areas that really feel not safe, and then have a broad discussion with lots of input about what are steps that can be taken to make it feel more safe. And there's no predetermined idea about what that is or about who will be excluded or anything. It's about broadening the discussion and being focused.
Right. I guess the last part, Katie, is about being focused. So we're not in this amorphous, we must solve the entire homeless, street crime, mentally ill problem on the streets. No, it's about, for now, as we're going through a major issue, let's create specific strategies that get some public safety in these very difficult corridors. That's all.
Mm-hmm. Mm-hmm. Okay, thank you.
Maria, can I, Betty, can I speak?
JD?
Yeah, I'm also, Katie raises a very good point. I think a lot of this is going to be done and guided by the precinct community council, which is made up of people who actually live here and go to the monthly meetings. So it will have a broad impact, a broad contribution from everybody. And I have to say, it's also important that you don't have a corridor that drives drug dealers to a next street. So everybody's going to be engaged in the community to make sure everybody is considered and feels safe, including the people at the shelters. So Katie raises a good point, but I think it will be a broad discussion of everybody in the community.
Okay, thanks, JD. Any other questions? Am I missing anybody? You're going to put a little yellow hand up, right?
The public, Betty, the public.
Okay, we're ready for the public. Okay. Nellie, you're going to see whether there's anyone from the public?
There's a few people with hands raised. I'll go in the order as I see them.
Okay.
Elka and Marissa.
Elka.
And Marissa or Dante.
Yes, hi, thank you once again, and sorry for jumping the gun earlier, but
thank you for being here today. You said it was your first time.
No, this is really important. I've been to other meetings, and then I was directed to come to this one to specifically address this issue, and I think it's the issue is compounded. It's compounded by the fact that there were all of these places brought into the community with no services, but then the combination of the lack of like any kind of policing at all in our neighborhood. I mean, there's little drag races happening almost every night at like ridiculous hours in the morning. It's pretty much, it's like a complete hands-off, as opposed to like if you go to of course a peaceful rally, then there's plenty of cops there, right? But the problem is it's just not being addressed. And I think it's ironic that there are communities who have pushed these shelters out of their communities. And we've like also taken on additional needs, but there's no services being provided to people. So again, I know a lot of people have said things about this issue, and that I know it's something that needs to be addressed, and it won't happen overnight. But one of those things that would help some of the parents feel safer. I mean, literally, we have parents who are too afraid to go out by themselves. I mean, we've had parents threatened, we've had parents assaulted, we've had people, somebody was shot. I mean, there are serious things happening in our neighborhood, and I'm disappointed that there isn't a community officer or somebody like that in this space who, unless there is, correct me if I'm wrong, but I don't see a community officer here. Is there? I'm sorry. Yes.
Not on the, I just wanted to just make a point. You are bringing up issues that have been coming up, not only at this forum, but at the police precinct council meetings for many months. And you are correct in noting that you're not seeing responses as you may have before. A lot of that is because NYPD is no longer able to engage in certain activity as they would, being proactive on the issue of the homelessness. But I just wanted to make one point of correction in terms of the drag racing that is being addressed. There is action trying to be taken. It is complicated, but hopefully I put my email in the chat. Contact me, we'll get you in these conversations. And it's important to have parents like yourself coming to more of the meetings to address what you're seeing on the ground so we can get specific responses when you're seeing it more in real time. So just wanted to offer that out. My email's in the chat.
Thank you. I don't see actually any information in the chat. It just says that it's disabled. So that's one thing. The other thing is that I will say that it's ironic that we're able to house so many of these people, but we're not able to provide any kind of stable housing for so many of our temporary temporary housing families who attend our schools locally, and they have to travel from places far away. And meanwhile, we have all the space apparently in Midtown Manhattan. Why aren't we housing our families who attend our local schools in our neighborhoods so that they have some sense of stability and some sense of, I don't know, support, community support? I mean, there are so many things that make absolutely no sense to me. And I would hope that this is the space to not only advocate, but actually make change, and that it shouldn't take months for these changes. Because we've been complaining about this for months. And I'm talking about directly to the local government representatives. I have their numbers and nothing has changed. So who do we need to talk to make something happen? What do we need to do to make something happen? That's what I would like. Yes.
The community board actually could not believe that the families in the skyline were moved out who had kids going to school and replaced by singles. We were like, this is the most crazy thing in the world when families were finally getting stable.
Yeah.
This has been, I will say honestly, as a community board member, one of the hardest things I had ever dealt with in my entire service on the community board. And it has been like we're blowing in the wind. So
can I just add something, Elka, really quick? So I am a single parent. I'm a social worker. I'm on the community board, grew up in this community, have lived in this community my whole life. And I think hearing people's experiences, like your experience, is something that drove me to be on HKNC, because I hear the frustration. I can see some of the things that people are talking about. Like when I've walked on the block with Brian on his block and seen some of the things, walked along 10th Avenue. I used to live around the corner from the skyline. The only thing is I wanted to add is that part of the issue is, just so everyone's aware who's listening, in these temporary shelter locations, many of them do have some services on site, not much, because we're, living in the time of COVID, you can't have staffing the way you used to. And there are providers who are working with the residents. There are also telehealth services. I think part of the issue is the services are not the same. They cannot happen in the same way. Also, sometimes it's about mismanagement of the provider is not managing their location very well. Sometimes I think it's also there's not enough space. So there's a lot of things I think that contribute to the situation that we're currently in. And I am glad to be on HKNC. I'm glad to be on CB4. I think we talk a lot about solutions and how to try to resolve this for everyone in the community. And I hear you, Elka, and thank you for being here. I'm glad when people are new and come to the meetings. I appreciate it.
And can you please give your contact information to Nellie, the district manager, so we can get in contact with you? That'd be very helpful.
Yeah, no, I would happily give my contact information and also be a part of whatever committee or board or whatever that's actually doing something about these issues, because, I just feel like so much talking has happened at this point. I'd like to hear some actionable steps that we can really take together to make something happen.
And I'm already biased to have you involved because you are a woman of color with some curly hair like me and Dolores. Okay?
Thank you very much.
All right.
So anyone else from the public? Nellie, where are you?
Marissa?
Marissa?
Yeah. Hi, can you hear me?
Yep.
Okay, I do have a little actionable. First of all, I have a medical thing I'm supposed to go to at 6:30 in the morning, and I realized I don't want to leave my house at 6 in the morning because it's dark out. So this has been going on since June. We all know that. It's not changed. It's gotten a little better since we had some policing for a bit of time. They removed that. But today I was speaking to the Skyline, who I've been badgering. And 45 people have been transferred so far, and 9 have gone into permanent housing. And that is because I think we are not going to get the policing we need, because they won't arrest anybody, because it's a revolving door. If there's a way to make that happen, that would help. But I think it's the providers that are not giving us the services. And because the comptroller doesn't have control of those contracts, he can't say, you're not doing your job, we're not going to pay you. So the only thing I think we should do, and I know I'm talking from a different committee, but we are all in the same boat, is to go after the bad providers. The Black Veterans for Social Justice are doing a great job. We don't have a problem at the Travel Inn. There's families there. There's not been any incidences. When we had the cachet, it was a nightmare. The cachet moved out. The Skyline, I'm going to be completely honest with you. It has been a relentless thing until we finally said, okay, we're going to go after the board of directors of your provider, because this location is not, your staff in this location is not doing what they're supposed to do. So things have changed a bit. I don't know if it's better. I know there hasn't been as much police presence there, but I don't think that the police, I mean, how are we going to make it safe, guys, unless they start having a no tolerance for troublemakers within the shelter, which is apparently the new guideline. So 45 people in a month have been transferred out of the Skyline. And 9 people have permanent housing from the Skyline. So basically, it's putting a fire under people getting paid to provide services that they're not providing. And every shelter is different, like I said. So I just wanted to offer that to us, because I don't want to see, the summer's going to be the same thing, right, Brian? It's going to be the same nightmare all over again, except your block's going to be a little bit better.
Well, first of all, I agree with everything you're saying, but I also
I got to intervene. There really can't be crosstalk among the presenters.
Oh, sorry, guys.
Right.
Oh,
So
sorry.
I'm done. I mean, unless if anybody wants to talk about it, but I just wanted to give you that information and hope that it continues in that realm. And it's really up to us to keep the pressure on the people as far as services go. It has to be different, but they have to be creative. I mean, I don't like that excuse, we don't have the space. Well, think of something else. Why are we thinking of book drives and everything? We're the volunteers, we're the community. You're getting paid to figure out something to do with gentlemen that need help.
Thank you, Marissa.
You're welcome.
Why don't we just check if there's anyone else from the public who wants to ask a question or make a statement?
There are 4 more.
There's 4 more. Next is John and David.
Okay, so John.
Thanks. And thanks also to all of you who have been involved in kind of keeping this issue in front of the community board. I live on 36th Street. I'm president of 315 West 36th Street Condo Association. I can't tell you how much we appreciate it. 2 things. One's a question, one's a comment. The question really is around the letters. We've been sending letters from the community board for a while now. I don't think they've even had a response, let alone any sort of effect. Do we really think this is an effective mechanism? I'm just worried that we're going to kind of be, howling into the wind on it. So maybe I'll pause there, and I don't know if anybody had any thoughts on that.
John, I'm going to then go on to the other people who want to speak, and maybe those that are involved in the organization can kind of collect up answers after everyone else has made a comment. So who's next, Nellie?
David Warren.
Okay, David?
Hi, do you hear me? Because I can't see myself. Do you hear me?
Yes.
Okay, great. Thank you guys very much for the work that you've done. It's a lot of hard work. Joe, you've been a stalwart for years. So, I mean, it's greatly appreciated. It's not unnoticed. I had suggested, and I'm totally agreeing to all this stuff in the sense of, the people that are actually in a hotel, to provide them with some recreational activity. But what I've noticed at the train station on 34th and 8th is that people are walking around like zombies. I mean, it's almost out of like a movie. And I, for the first time, I actually saw sitting on the steps people with syringes. I didn't see them injecting. I saw them holding syringes. I closed my eyes because I just don't like needles. But so, I mean, I don't know what the solution is. I mean, this is because I don't think that warrants a police action. And I don't think these people necessarily are living in the hotels / shelters. I think these people are just without homes and they're on the streets. I don't know what to do. I mean, especially if you have, I don't have children, but if you have children, it would be very upsetting because, as I said, these people are, I'm repeating myself, are zombies. And in response to what Erica said earlier about the drag racing, this is my suggestion, is contact the New York State Police, the state troopers at Javits. They have a vested interest to enforce it because the state gets the money and the points on the licensing. So and have them go out at specific times. I think these state troopers would be glad to do it. I could be wrong. Whereas NYPD, you know, they don't have a vested interest for them. But once again, if I could help in any way, I would be glad to help. But I think everyone on the committee has done a fantastic job. And Maria, thank you for inviting me.
Okay, thank you, David. I think it's Paul next, Nellie? Paul?
No, I have Randolph and Bobby.
Oh, okay. Randolph.
Hi, this is Randolph Barksdale. I live on 36th between 8th and 9th. I'm the president of 348 West 36. And first, just thank you for the production we got at the DoubleTree. And I'm wondering, however we made that happen, however you made that happen, can we do those same channels again to get some reduction? Because I don't want to repeat the same thing over and over again that the other people have said, but it's still the same problems on our street with the drugs, with the crime. I don't feel safe walking out at nighttime anymore and having people over. I haven't done that, forget it. But I'm wondering what can we do as far as look at what has worked and maybe try to repeat that again, because I mean, we have a long way to go to make the neighborhood like it was livable and feeling safe again, at least on this block. But I would just like to continue working on it, because not to repeat everyone else's examples of the trouble we see on the street, but we still have a long way to go. So thank you, but let's just keep going.
Thank you, Randolph. And Nellie, who's next?
Bobby.
Bobby?
Are you able to hear me?
Yes,
Great.
we can hear you.
Great. Thank you so much. And thank you for putting this together. I so appreciate it. I definitely share all of the concerns that different speakers and the presenters have raised about street safety and Hell's Kitchen in Chelsea. I guess I'm a little concerned just as the resident and a citizen about like equating crime with shelters. I know that there's been an attempt to kind of tease this out in the conversation here tonight, but I was hoping that perhaps the presenters could talk a little bit more about the causal relationship between the shelter sites themselves and crime. I know that there was the mention of drug dealing and how that creates clusters, but if there are any more pieces of evidence that support the idea that shelter sites themselves create issues, I would definitely be interested in understanding this a little bit more. I definitely worry about antipathy against unhoused residents in the neighborhood happening and that having a negative effect. So I'd really like to hear a little bit more about that. Thank you.
So I want to take that.
Can I jump? Oh, okay.
No, I want to take that first, Maria, because I want to take it on a much more sort of basic level. So this entire group, myself included, I have worked with affordable housing for 41 years and with homeless individuals for maybe 39 of those 41 years. You don't have in a group like this that immediate knee-jerk homeless people are bad. No. However, when you have poor management by shelter operators, those homeless individuals don't get services they need. People who are in the middle of relapse or dealing with all kinds of mental illness do not get the normal services they would get in a congregate shelter. And they're struggling as it is. When you say causal relationship, the HK, the Neighbor Coalition, has direct video of shelter residents having violent fights with security guards, with people on the street. There's been a whole series of incidents. So it's not like it's a causal relationship. It's fact and watching people get involved in an altercation and literally walking in and out of the shelter or getting in a drag down, knockout fight with the security guards. Now, what's happened, unfortunately, because you have so many people with social problems in the same location, other people come to prey on them. So there have been clusters of drug dealers gathering around certain blocks like 36th Street because they know there are people who are, addicted there and have substance abuse issues. The third thing that's really important is we have just basic street crime, which is sort of getting conflated into the shelters. That's not a shelter cause. And we also have homeless mentally ill that are not in the shelters. The problem is you have homeless mentally ill in the shelters. The public, as you walk around, don't understand the difference. And what we're trying to do here is a very nuanced, thoughtful approach to say, listen, right now we're trying to sort all this mess out. There's a lack of policing. There's a problem with the shelters not being managed well. There's no plan to bring people back. How do you retrofit a congregate shelter to bring people back? What about the vaccination? All this stuff. The streets have to be safe for the public in the meantime. So we're very clear that this is not pointing, it's the Skyline or it's the Doubletree, although the Doubletree, we have a video of people like getting, punching each other and like having major altercations. This is, how do we deal in the meantime as we're trying to figure out a long-term plan toward bringing some safety back, the corridor on 10th Avenue, the corridor on 9th and on 36th and 37th, because truly, I walked home last night and I had to get between three guys having an argument about Lucy's and selling cigarettes. And they started to go at each other. I was just walking home down 9th Avenue. So that's our everyday life. And I want to say, as a long-term resident, I get really frustrated when someone says causal relationship. No, it's on the street, on the sidewalk. How do we manage it? Because, we're not a community that says homeless people are bad. We're a community that says we need to be safe as we walk home. And you, City of New York, have created a huge problem by not managing this. And there's a whole, right, I guess the phrase that Katie talked about, the nexus of all these problems, they get entangled. And we can't just fix one problem, we got to do it all the way around. That's why you hear my passionate response, Bobby, okay?
I appreciate it. And thank you for taking this on with nuance. I really appreciate that this board, I've heard terrible things from other community boards. I really appreciate the compassion that comes from this board.
Thank you.
Bobby, from the HKNC, I'm a trained social worker. Maria's a social worker.
And I'll say something after you, Travis. Thanks.
Joe has worked in these communities before. We are sensitive to the issues that plague those particular communities, and we're very sensitive to not being a NIMBY organization. And I've worked against NIMBY organizations in the past to help provide social services to people. The key issue here that Joe highlighted is one of the key issues is the fact that we know that some of the places have been poorly run, and we've witnessed some of the activity. The recording that Brian has from 36, when Cache was across the street from me, I witnessed a number of fights break out over drugs that someone had stashed away in a lanyard down the street. We've seen catcalls and women get harassed at that particular station, and lewd behavior all the way around. And it's not that everyone knows that what comes with living in a city, and I've lived in tougher cities in New York, as hard as that is to believe. So I'm not shying away from any of the rough things that occur living in a city. It's just that it's more than that, and it's being mismanaged by the people that we trust and entrust to manage this stuff for us.
So I know it's almost 9:15, and want to be respectful of everyone's time. And I just want to ask Joe and Maria, do you want to have a vote on the mission statement?
I think we're really talking about, in the midst of all this, to support this idea of these public safety corridors, one on 10th and one on 9th and 36th, 37th, as something that would be helpful to get us to mitigate some of the issues as we go through this problem.
So is that tied up with this mission statement, or is that a different specific topic that should be focused on?
The mission statement is just wanted to let you know who we were as an organization in general, but our request really is about to get this to become part of the agenda to bridge us to where we're going. And by the way, I'd like to announce to the committee, while we sat here, one of the elected officials was trying to set up a meeting with the HKNC and the elected officials. One of the staff members actually just emailed me during this period of time saying they're close to getting a date. So hopefully this is moving ahead too on the broader issues.
Okay, so
I make a motion that we write a letter in support.
What are we doing here now? I know I can help you. Is it that the organization wants a letter of support for the organization based on the mission statement, I would assume, and based
a letter of
based on
support.
their mandate, their commitment to addressing and taking on this issue. And we can mention the importance of a public safety corridor, but more importantly, that we are in support of our neighbors standing up for and mobilizing to gain support with electeds for this issue. And I'm so sorry, but my computer is about to die. So I'm gonna have to find a plug, but it looks like we might have a second. Or JD, is that a question?
JD,
you're on mute.
So sorry, I beg your pardon. I would support Jessica's motion, but I'm a little concerned about saying we need corridors without a little further discussion. I don't know how that works. So I would rather the board not insist on that until there's a little more fleshing out of what exactly that means and how the community would respond to it.
Joe, you're on mute.
I think it should just be explore as opposed to support.
Okay, I accept that and Jessica's motion.
Okay, and this letter is going to go to elected officials? Okay, so we have a letter to elected officials that to explore the corridors and to
explore the creation of the public safety corridors and to presumably create meetings or welcome people to make sure that there's lots of inclusivity on getting ideas about how to address it best. Is that right?
Okay. All right, so we had a second to Jessica's general motion, and should we have a vote now? So
I'm sorry, Betty, before you continue, I just realized there's two other people from the public that have their hands raised.
Oh.
Can we vote first and then have them speak? Is that
Yeah, we're
okay?
sort of have a momentum here.
I'm sorry, I just wanted to point out there, I still have two other people, but go ahead, continue.
Part of the discussion.
What'd you say? JD?
There was a second, now there is a discussion, so.
Okay.
I think
Is there any discussion about the motion, or can we vote now? It seems kind of quiet, so how about, can you just raise your hand if you're for this letter? Is that, you're good?
Aye.
Okay, Joe, is this an okay way of doing this?
Yes, but
I am
present not eligible.
Present not
Oh,
eligible.
yes, and the people who can't vote. And Leslie, I didn't see your hand. Was it in the dark and where the moon is or wherever it is? So that was a yes? Were there any?
No, I'm not going, I want to hear more. I'm not voting for this at this particular time.
Who said that just now?
That's Leslie.
Leslie. Oh, Leslie is like abstaining, I guess.
Yep.
And then I'm not writing this letter. I'm just taking some notes. So
Betty, I'm PNE also.
Okay. So there's Joe, and there's Maria, and there's Dolores. Those are the people who can't vote? Okay, so I think we're done on this topic. Except there were two people from the public who wanted to say something.
Well, also, who is gonna write the letter, or who's gonna draft it?
Katie.
He who speaks drafts.
Well
Jessica-
played, Maria, well played.
Jessica volunteered
Never asked.
help with the letter also. She wrote it in the chat before her computer died.
Oh, that's great.
Will help with the letter. I'll put the letter and
All
then,
right, I'll work with Jessica on it. Okay.
and oh, wonderful. Oh, such two good writers. Okay, so that's that. And then Nellie, just tell me who are the two people from the public who wanted to come?
There's Christopher
Christopher?
and Lilibeth.
Okay, so Christopher?
Christopher.
Hey, can you hear me?
Yep.
Hey, thank you for hearing me today. I just wanted to say, I hear a lot of people talk about shelters and everything else is causing these problems on the streets, and I wholly disagree with a lot of that. I think one of the reasons we're seeing this increased amount of stuff on the street, if you look back to Jane Jacobs and her ideas here, is that we don't have as much community members on the streets. The shops been closed because of COVID. The bars and restaurants have all been closed. And we've really created a void for them to come in and to kind of take over the streets and help create the safety problem. So I'm wondering if we've done anything to maybe even just step up people on the street somehow. Are there volunteer organizations we can join as members just to even stand on the corner and let people know that, hey, the community is still here and we won't really tolerate you doing this kind of stuff in public. I don't mean to be the vigilantes that I saw on the Upper West Side and try to run people off the street, but just to be able to create a presence on the street.
Thank you.
Taking my concerns.
Thank you, Christopher. And then is there's Lizbeth?
Yes, hi, Lilybeth. How are you? Lily's fine. Good evening to the group. I'm very thankful for this opportunity and this committee that exists, because it kind of feels now with COVID that some of these connections to the community have kind of disappeared. I'm a Jersey girl who moved to New York City 15 years ago. I've been married, and I've never seen the city the way you see it now. And I never feared bringing up my twins in New York City. I never feared walking to the store at 1 o'clock in the morning. There was never that sense of fear. And so now, although we're a small group, I'm hoping with this and other advocacy groups that we can definitely make steps towards change, because simplicity in the eyes of a child tell you a lot. When my daughters are walking down the street and they say, "Mommy, what's wrong with that person?" And I have to explain heroin and drug use, and I have to explain needles laying in front of them, that's a problem. When I'm walking down the street with them and there's a man blatantly peeing with his stuff out, and my daughter catches a glance by mistake, and I have to, that's a problem. When I can't walk to the supermarket without fear of being heckled or borderline harassed, which I've had women that have been personally harassed just by Manhattan Plaza in plain daylight, that's a huge problem. And so the shelter system, no, it's not to blame at all. The system is broken in many ways in the city, education wise, community wise, police wise. I mean, we're just a broken city. But it is absolutely vital that we do something, because it is horrible. It's horrible, the things that you're seeing and having to live through. And this is coming from parents within my community. I'm part of a PTA board for Elias Howe. I never have had a problem walking to school until this. And you can't walk down that block without seeing something bad. You can't walk to Chipotle without knowing that's the drug corner. So don't go near there. I mean, I've learned how to look, but I don't go out past dark anymore. And so it's sad that Midtown has turned this way, because it was never like this before. And so it's easy, yes, to point fingers to shelters and stuff, but that's not the problem. The system's broken. They're not supported. They're not getting the services. And we've had cops blatantly tell my brother-in-law, when a group of those people are taking over their building, to tell the mayor they can't do anything about it. Okay, so there's a real disconnect between our police force and us as a community as well. And I think that that is one key thing that as a committee, however you've handled in the past, I don't tell you what to do. By all means, I'm new to the group, don't judge me. But our connection to the police force has been lost. They have no faith in us having faith in them. Therefore, it's almost like, well, you're on your own. And I don't care what anybody says. The sentiment is there. Maybe not from every police officer, but it's there. And so if we can reconnect with our police officers, we might see a significant change in just those simple things and simple interactions. So thank you again, and hope you have a good evening.
Thank you, Lilybeth.
Thank you.
Nellie, are we anyone else from the public?
Um,
No. Well,
Motion to adjourn.
hey, Betty, Betty, can I just for 1 second?
Yeah, I said last thought.
Okay. I want to do something unique here, which is to thank everyone on this committee. As a resident of West 36th Street, the past 9 months have been very difficult to endure. You guys have heard it from us, largely at this committee, but also in full board. And shifting the DoubleTree off of our block has provided a little bit of relief, a little bit of much needed relief. We still have a long way to go. There's still a lot of drug activity on our street. Black Veterans for Social Justice is the other shelter. I know we've had great success with them elsewhere in the neighborhood, but they have issues on 36th Street. But I really want to thank you guys for your support and also for giving the community a public forum to come and speak at. Most people don't know how to get in touch with their local elected officials, and this is the one place that the community has had to turn during this time. And I think that it's been slow moving forward, but you guys have done an incredible job, and we really appreciate your consideration and compassion. So thank you.
Thank you, Brian.
Betty, I'm
Yeah.
sorry. I know we want to move things along, but I just
Joe,
wanted to.
you're on mute.
Sorry.
Brian Lewis,
I
the
just-
borough president, has his hand raised.
Oh,
Oh, I'm sorry. Am I speaking?
no, I think that, Joe, you're indicating that Brian wants to talk?
Yes, Brian
well,
Lewis
I
from
think you could-
the VP's office. Nellie, can you bring him over?
Okay.
Oh, hi. Yeah, good evening, everybody. I just wanted to jump in because I heard someone had made a motion to adjourn. So before that happened, I just wanted to jump in.
No.
Oh, okay. Well, I just wanted to jump in really quickly to make a plug then for community board applications as it is going on right now. And after seeing all of the real passionate conversation about this issue, I feel like it's really important to mention that joining your local community board is a great way to become part of the solution to this. So yes, community board applications are open also for you members right now. If I've given you an email to reapply, please do as soon as possible. I will drop a link in the chat if I have that option. And again, sorry for taking your time, but I really do appreciate the conversation about this.
Thank you, Brian. I think that Maria and Joe can take over doing the rest of the meeting now.
Yes, Hector wants to speak before we get to the very last report from Maria.
Okay.
Hector?
Yeah, just real quick. This is just a response to one of the young lady who spoke that there's a disconnect between citizens and the police. I invite all of you, especially that individual, to attend our social and racial justice task force that we have, and it's scheduled every month. You can check it out at the CB4 website, and we're coming up with initiatives to try to make the situation a lot better and improve things, especially when it comes to police dealings and their dealings with the community. Okay.
Okay. Thanks, Hector. I'm going away now. So
thank you, Betty.
We will end with a very short report from Maria about Stardom Hall on West 51st Street. Very short, right?
And then the giveaway, and then Twee also wanted to mention something for new and old business, but I do want to say something that I was going to mention to Bobby earlier. I'm not going to repeat everything you and Travis said. I agree entirely with you and Travis said. The only thing I was going to add is that the one thing that when she was talking about equating whether you're sheltered or unsheltered, you're homeless, and equating that with crime, I understand her point. I hear it. I get it. I totally get it. The only thing I wanted to add to that is that the one thing that doesn't get brought up is that when we're talking about folks who live in shelter, most of the time they're people of color in this city, right? And I think that's something that I am cognizant of all the time, right? We talk about folks in shelter, right? But it's people, and mostly we're seeing people of color and people who are poor. I'm cognizant of that fact. I am a social worker. I have worked in shelter. I have lived in shelter as a child. I have a love and a deep passion for people who suffer, people who struggle, people who have been traumatized. Truly I do. But I can also see certain things that I find are unacceptable. You cannot violate other people. There are certain things you should not be allowed or able to do on the street. And sometimes it's the simple fact that people are not receiving the right resources or the right support that they need. So I just wanted to share that.
So let me just ask Maria to give us a short report, super short, on Stardom Hall.
Oh my God, I wrote these notes. I'm gonna do it really quick. The short report of it is, I can make it shorter. I will make it short, and anybody who wants further information, you can email me, we can talk about it if you want some more details. And a lot of this information is on the Community Board 4 website. Basically, I wanted to give an update that things have gotten better. And if you remember, we were meeting at the end of 2019, I believe it was, or early 2020, we restarted the CAB to meet with the CAC, to meet with Stardom Hall every month. And we also wrote more than one letter. And in one of them, we asked for specific tangible kinds of requests, 4 of them. And we asked for a letter from Stardom Hall or Lantern Community Services, and they did provide us a letter with some changes that they were going to make. They actually did make those changes. And so now at this point, as of October, we don't meet every month anymore. Now we're meeting every other month. And yeah, that's the short and sweet.
And there were disruptive individuals who were removed from that building because they were the source of a huge problem on that block.
So really the things that really helped to change things was that Lantern actually did and made the changes they said they were going to make by the timeframes they implemented, except with one thing that's outstanding. They're just trying to hire 2 more people. 2 of the most disruptive tenants were incarcerated. I believe 1 was moved,
Yes.
and sadly, 1 passed away at the end of December. But yeah, so I just wanted to give the
follow up because Leslie, you live on the block. Are you actually seeing?
Thank you, Dolores, for that. Yeah.
Quality of life improving, because I know that it's been a struggle for everyone on your block.
Yeah, it goes back prior to COVID. We've had the problem for 2 years prior. We've been raising this issue. And thanks to the work that Maria has been doing, there has been a noticeable improvement. We don't have those characters on the block, those actors. We don't have them standing out in front of the building. We don't have them following people. They don't come into my building anymore in the lobby as they used to. And I've not seen any muggings reported down the street as we had in the past.
Mm-hmm.
So it is an improvement. One of the things that we are waiting to see what will happen is when WIN opens up again and how that will be brought back. But thankfully, it's a success. I have to, applaud Maria for the work with that.
Yay, thank you. And I will add, Leslie, that that's a great point about WIN. One of their plans, their strategy is that they will be coordinating with WIN once they return to do patrols on the block and have certain protocols in place to deal with any issues.
So I just want to give Maria Ortiz the Community Board 4 Persistence Award for 2020 and 2019, because the truth is that we are successful as a board because we keep at it even after people say it can never happen or can never get settled. And thank you very much, Maria, on behalf of the board for that.
Thank you, Joe. And I learned some of that from you. It is very true, being persistent and staying on things, just like we're doing with this issue with the temporary shelter relocations.
So we've had a very long success. Go ahead.
Sorry, I'm just wondering if it's appropriate now for a motion.
That's what I was trying, but Maria has something else to say. What do you want to say, Maria, quickly?
Dolores, wait a minute. I just want to mention the giveaway that we did in December. I think I already talked about it, but we did good with the coats and the socks. So at this point, I'm going to make it short and sweet. I'll say more at the full board, but I want to do it again at the end of February. And this time we're just going to do socks and underwear because that's what I keep hearing is the most need. So we're going to do that for men, women, and children who live in shelter in CB4. Yes, and I'll say more next time about that. Also, the DHS COVID vaccination plan, I just wanted to share with everyone that in my meeting this week with DHS, I found out that they're giving their clients Moderna. There's one distribution site in each borough where clients and staff can go. It so happens in Manhattan, the distribution site is actually in CB4. In Chelsea, folks who live in shelter actually have to register. And the priority is those who are seniors who are living in congregate settings. So they go first, and then next it's by shelter site location.
Well, Maria, it's senior or congregate.
No, it's what Yvonne, I forgot what her position is at DHS, but senior management, is that it's seniors who live in congregate, who are still in congregate shelters.
Got it. Okay, sorry.
Yeah. And then I know that Twee wanted to mention something, and I said for new and old business before you adjourn.
Okay, I know, but our problem is we're at 9:04. So if it's a new matter, Twee, can we ask you? Is it something that if it's the matter about the ventilation, we want to consider this in full? And can you bring Twee over?
Yes. Twee?
Twee, you there?
I unmuted myself. I'm here.
Okay, good. So is this about the ventilation in your building?
Not just my building. This is going to be throughout because also 308 West 30th has been affected. So, and I was also recommended at the full board in January to go to you guys.
Okay, so if you could present to us but understand that at 9:05 we're really in a brutal time, okay?
Yeah.
Go right ahead.
I know. I waited the whole time to talk, and I have a script ready.
And that's why I'm saying you got the persistence award too. So go right ahead. Keep it brief, okay?
I'm speaking as a president of 2324 Chelsea Tenant Association with almost 250 tenants in a building complex across from the Chelsea Hotel. In a so-called renovation that defies logic during the pandemic, management has replaced the common hallway windows on every floor with sealed windows, preventing air circulation. In addition, workers perform non-essential housing without wearing masks on a continual basis. As a consequence, at least 3 tenants and some building staff have been infected with COVID-19. Air circulation is vitally important in residential buildings and not just in commercial buildings and schools. To that end, the 2324 Chelsea Tenant Association is organizing a residential housing ventilation forum to educate the public about the importance of adequate ventilation, not only to prevent COVID-19 infection, but also to reduce the effects of dust and toxic paints from non-essential renovations and construction, for example. We aim to have an architect, a medical expert, an attorney, and a journalist on the panel. Housing conservation coordinators, the New York chapter of the Urban Planning American Planning Association, and 308 West 30th Street Tenant Association are sponsoring our efforts towards this forum scheduled for the end of February. The February panel will not have any political candidates or Department of Buildings personnel. Instead, a follow-up panel in early March, 2 weeks later, will be created for any political candidates to respond at length and outline specific possible solutions based on the information presented at the Residential Housing Ventilation Forum. Those candidates must have attended the February forum as attendees in order to be on the panel in the beginning of March. So the ask is whether or not this particular committee knows of any architects, medical experts, attorneys, or journalists who have had experience and exposure, no pun intended, to the ventilation issue, because 308 West 30th Street is in support of this forum because they are also dealing with non-essential housing construction. So ventilation affects not only the COVID-19 problem and have the air circulate, but also for the non-essential housing. Thank you. And I would like to follow up if anyone, has, I could follow with the panel if they have any more information about that.
So the request is to support your panel, which is happening, but then see if we can refer any professionals to assist you. Is that correct?
yes, who can speak, for example, an architect can say, you need to have open windows open at least 6 inches for proper ventilation, or someone, for example, who would, and I'm an attorney who says, okay, the CDC guidelines say this, New York state laws are bereft. New York City laws don't say anything. Those need to be updated, things like that.
Well, maybe in terms of the assistance, I would think also reaching out to Ryan Health Center, because that speaks to the health aspect of it, is more than an attorney. It might be helpful.
For ventilation purposes.
Yeah. We had a presentation from Dr. Siddiqui from Ryan Health Center today, and there may be CDC guidelines speaking about ventilation very specifically. Like, if you remember, there was an article in the Times just a couple of days ago about traveling in a car, keeping windows open to allow ventilation through. So there may be something in CDC guidelines about air changes.
We are aware of the CDC guidelines. We've sent the link to the Politicos. We are saying they're working on an issue, which is why we have the panel, to bring it to a head, to bring it to the greater population of Manhattan and MCB4, to say it's not just us, it's not just 308 West 30th. I'm going to be talking to the Chelsea Council Block Association as well, and the West Side Neighborhood Alliance next week, to see about other buildings and say, yes, this is an issue in our building as well, to gain the momentum and to have the politicals hear us, which is why they'll have an opportunity 2 weeks later to present possible solutions that conform or comport to CDC guidelines, and having already heard an architect, Ryan's Health Center, for example.
Great. Okay. So the specific request is do you want the board to support the forum also?
Yes, and I'm not familiar completely with everyone's background, and I call it the Triple H services, but with regards to, I know that in my neighboring building, there's an issue with ventilation because they keep every door shut and then it's stuffy or something.
Well, I think we can easily support the forum. I would, if members are in agreement, we can give me a head shake or a thumbs up on that.
Yes.
Okay, good. And then we can ask that Jesse do some polling to see if we can make any referrals to you regarding professionals that might be able to help you with this. Is that useful?
Yes, thank you very much. And I'll see if I can touch base with the Ryan Health Center as well.
Great. So, now I think we are at the end. Is there a motion to adjourn?
On the Chelsea Land Use Committee, so we might talk about this briefly at the next Chelsea Land Use Committee. Okay, Twee?
Okay, that sounds great.
Can I also mention one thing? There's an organization called BOMA, B-O-M-A. It's the Building Owners and Managers Association. They may also provide some assistance because they do a lot of work on buildings and ventilation and those kinds of things. So that may be a source to look into.
Do you have a particular contact in mind, or I'll just reach out to?
It's on BOMA.com. It's BOMA, New York, Building Owners and Managers Association of Greater New York.
Okay, thank you.
BOMA.
So Dolores, did I see a motion to adjourn?
Yeah, there's a motion to adjourn. It's been a really good.
Guys, you've been fantastic tonight. Very much. Thank you all very much.
Thanks, y'all.
Thank
Good night.
you.
Kelly.
Good night.
Thanks
Good night,
for sticking
everybody.
through.